Good morning, Dr. Telfair.
Yeah, good morning. How are you today?
I'm doing well. I just got a buzz from Lizanne and she is almost there. So whenever
Okay.
you kick off, I'm happy to, she asked if I could, if I needed to say a few words, that I could do that. So anyway, just since she's not quite in place yet, but she's close.
Okay. Well, I leave it up to the two of y'all, and I'll get started. We have a bunch of announcements and that sort of thing, but I'll leave it up to y'all and handle it the way you think is best as we get started. So whatever you think is best.
Well, I think, Rachel, you're here. I think I saw you. There's Lizanne. Okay, good. We are 100% good to go then. And I see that we have 28 participants. So Lizanne, back to you and Dr. Telfair.
Good morning, everyone. We're glad you're here this morning. And we're looking forward to getting started with our Foundational Skills 201, which it builds on the program design that we had in the fall. And we're glad you're with us, and we look forward to working together. I know that we have an agenda this morning. Rachel, are you going to pull that up, or is Dr. Telfair, you've got it?
Yes.
Okay. I was reflecting today on just how much we have to gain by this work. And I know it feels sometimes like, carving out this much time in a day. But the investment that we're making now will yield great returns as we learn more about evaluation, learn more about how we can measure what we're doing to leverage that for growth and development within our community. So, Dr. Telfair, we're glad to have you. We're grateful for you, and I'll turn it over to you now.
Okay. I'm not seeing this screen that I have. Give me a moment. Sorry.
I see the foundational skills, and then I see for foundational skills for community leaders, the certification workshop.
Yeah.
That's what I'm seeing.
Okay. Let me try this again. Sorry. Yeah, I'm not, my screen is not coming up. It's showing some kind of Zoom background. So give me a moment.
Of course. While we're waiting to figure out what our glitch is this morning, if you have not already done so, if you would put your, just sign in the chat feature and put your name and organization so that we can capture that. I'm hoping that everyone caught the email that was sent out with all of the information on it. For some reason, if you did not see that, if you would shoot us a quick notice in the chat, and we'll forward that to you. But I think everyone that registered was sent the information. Dr. Telfair, can you see the screen now?
Now, I think I'm gonna have to go out and come back in.
Okay,
because for some reason or another, I'm getting some, it's pulling up, but it's pulling up somebody else's screen. So sorry about that. Uh,
Dr. Telfair, if you want to go out and come back in, or and then we'll look at it on our end. Everybody, take a big breath, stretch, and grab another cup of tea or coffee, and we'll be right back. Dr. Telfair, are you seeing it now?
Ms. Roberts, do you see the foundational skills document?
Yes.
Okay, all right. So it just looks like I'm going to be on a different page than everyone else. I'm not quite sure what's going on, but anyway. So good morning, everyone. My apologies for the mix up here. I will do my best to make sure that we follow through. I'll try to see what the glitch is and fix it while we're offline. So what we have for this workshop, and thank you for the introduction, Ms. Roberts, on this one. So what we're going to do is that we plan over the next 4 days or so to review a number of areas that will be able to get you as a leader, as well as a person who works in the not-for-profits, up to speed with at least the basics, the essential skills, if you will, for both monitoring and evaluation. We will take time to explain both the differences between the two, the importance of it, of the work itself, and then where we will go. So if you have in your packet, and I'm going to go over what it is that we sent you and what Ms. McConaughey sent you in your packet. So the first thing you'll see is this screen here, which is the pre-workshop. So we are going to cover some over the slides. I'm going to show you, he's going to talk about work and purpose in the workshops. What we're going to cover are these areas here, which is the agenda for the next several days. And it's going to cover these areas, both essential skills, from the fundamentals to the definitions to the how to do the work itself, and as well as close to the last day and a half, we are going to engage with you in the ways to practice developing goals, objectives, evaluation structure, and what you need to do for your work. So one of the things that we have asked you to do and continue to ask you to do is consider bringing projects that you either have working, projects that you are planning to work on, projects that maybe have come and gone and you needed more work on, grants, contracts, things you've submitted, gotten feedback on, and so forth. So if you bring those with you, then these days here, which is covered in the last day's essential skills, we're going to use a number of tools that I will share with you that is in the packet that I've given you, a number of tools that will show you some of the ways, or one of the ways that you could put together and use the work that you have. Also to develop a monitoring system, develop evaluation system that works for you. And this is work that we have covered, has been involved with for a number of years. And then there's a handbook that we developed, myself and another colleague of mine, when I was in Alabama, we developed, and we've been using for the last, decade or two, that has really helped a lot of people with this. And this is putting together 8 steps for writing measurable goals and objectives, and then a worksheet that allows you to practice that. So again, on day 3 and day 4 in particular, please bring that with you. It's going to be a number of talking and going over points for the next couple of days. So that's the first thing that we have for you. The next thing is one of the tools itself. And hopefully on your screen, can you see the thing that says tool for project achievement matrix? Ms. Roberts, can you see that?
Yes.
Okay, great. All right, so this is a tool that we are going to say for day 3 or 4, but I want you to at least have a look at it and see, because this is something that we use with Healthy Start. And it is some work that we've done with them, and some training and work that we've done with them. The next tool that we have, of course, is the components of a monitoring system. And this is a pretty straightforward, hands-on way of teaching you how to develop your own monitoring system. And this is a concrete example of how to do that. We will take time to walk you through this. We will take time to, for you, hopefully, we'll bring a project that you've worked on or working on, and we will show you how to plug that into this work. If you have, for example, a plan, that's great. If you have a logic model, that's great. You can bring those, and we will work with you on that. The other document that we have, of course, is the 8 steps planning guide, and it's assessment planning guide. It's fairly long, but it walks you through 8 steps for writing measurable goals and objectives, as well as what to consider on this one. This is a book we developed, and it's
put a picture of Martin Luther King on there for me. Thank you.
This is a book we developed, and it's something that we were willing to give y'all to work on and to work with. And of course, any textbook would not be complete without a working worksheet to go with it. So this is the worksheet that accompanies that book, and we have that in your packet, and you have that with you. We'll walk you through it as well. We expect that it's not going to be a complete work in terms of what you have, because a lot of this is us sitting down with you individually and working through the project. However, these will at least get you started, and we could work on this as a group, and you will begin to see this. So these are all those books and materials. I strongly encourage you to look those over before the session. And then what we have, of course, is a lot of you work in settings where you are responsible for putting together reports. We're responsible for putting together data and making sure that that data meets standards and targets that you have set. So we have developed for you a set of slides that goes over a lot of the materials that are generally asked of you by governments and other agencies. This is just more of an FYI handout. We will most likely not use this one, but I wanted you to have it so you could see how it goes. The other work that we have, of course, are these slides here. And these slides are the documentation tools. They are a walkthrough, an essential summation of the work itself that we are going to be doing, how to use both the project tracking matrix, the book program assessment matrix, the 2 things that I gave you the Word documents for. So we're going to use those and to have that as a handout to work with you on that. So if you could take a look at that, that'll be great as well. Okay. So why don't you go over those two? So before I get started with that and started with today, do we have any questions related to the handouts and the materials? Okay, I don't see or hear any. Ms. Robertson, so kind of, do you see it? No?
Yep, we're good.
Okay, all right. So let me start. Okay, so I just want to make sure you could see the screen here.
Yes,
right.
sir. We're seeing the
right.
opening screen.
Okay, great. Okay, so not sure what happened there. Okay, can you see the screen still?
Yes.
There was a change. All right then. So today we are going to start our second essential skills training module. The dates that we have are today, next Thursday, and then we will move to February, the first week in February and the second week in February. And those are the days we have. We encourage you very strongly, if you are you're not signed up for all 4 of the sessions, to make sure that you attend to the videos. That is the recording for each one of these, to keep up, because it will require some carryover knowledge for the work itself. See, in this, and I want, again, we are, us at Southern, we want to thank both Healthy Savannah and the Coastal Georgia Indicators Coalition for their partnership in this work, and then to my colleague, Dr. Ramona Lawrence, who allowed me to use some of her work as we share with this. So let me take a moment and go over the purpose, the overview, and some questions. So the format that we have adopted is based upon feedback that we received from y'all. Many of you provided comments in terms of ways that we could improve how we present these workshops. And so we've listened to you and we've made adaptations based upon that feedback. And we've ran these adaptations past a number of persons, and we hope that they will meet and address some of the concerns that you have. So we appreciate that. What we will have after each of the modules is a short session related to giving you a chance to ask questions, get questions answered, bring up issues, concerns, unique observations that you may have had. And this will be after each one of the modules, and it'll be at the end there. And the purpose of that is to try to give you the opportunity to engage as much as possible with the training itself. We will do a lot of talking, but at the same time, we want you, and we encourage you very strongly to take a moment, think about what you have just heard, and ask questions. And we want you to be able to do that. So that's why we will have those sessions there. And we want to be able to address those as best we can. What we want to start off with, though, before we get started, is to see what are some of the areas of monitoring and evaluation that you consider important or areas in which you would like to be able to make sure that as we go through the work, that we highlight and address questions. Do you have some questions and areas that you want us to address to make sure that we cover adequately before we get started? This is a question to you as the audience. Do you all have any? So there are some in the chat. I saw some Miss, I think it's Miss Rs Keller, if I pronounced that correctly. You're asking about, are we going to talk about measuring impact as well as outcomes? We definitely will. We'll talk about that when we talk about the difference between monitoring and evaluation, and we'll better define the difference between impacts and outcomes, because that gets really confused a lot by people, and I want to make sure that we are very, very clear about that. Another question that comes up early is, how do you evaluate projects that are not necessarily programmatic? So I think I know what that means, but Ms. Rain, could you unmute yourself and clarify that a little bit?
Sure. So with Healthy Savannah, a lot of our projects are mostly like PSC, not necessarily programs, but we do like when we're applying for grants and we're working on something, we still have that evaluation component. So I wanted to better understand how to evaluate things that kind of stray from the standard programs. Yeah,
we will cover that. We may not state that explicitly as you have, but we will cover that when we talk about the way that you consider how you put a program together and how do you write measurable goals and objectives that will best fit what you have. I think we'll cover that. But however, if we do not cover it adequately, my hope is that when we have the end of module Q&A, that you will bring that back up again. If I can ask you to do that, please. Does that work, ma'am?
Yes, thank you.
Okay. And then we have from Mr. Bullock, collecting data, especially community-based data. Could you clarify a little bit about that? Or is it a question simply how to collect the data, community-based data, or what kind of data?
Primarily looking at what type of data, community-based data, that would be essential in evaluating outcomes and measuring impact. Okay,
so two things there. First of all, if in the 8 Steps book, we have a large section on measuring and creating data. How do you create that? How do you put that together? How do you make that work? Secondly, we definitely have a whole session in our presentation on just that. So we will walk you through sources of data, how to conceptualize data, how to create measures, and so forth. And if you have additional questions after that, please feel free to ask. But we cover it in 2 ways: one in the handbook that I showed you, the 8 Steps handbook, and then one in this session that we'll go over. So we should be able to cover that. Thank you. And then Ms. Anderson says how to best measure the success of one-day events. Yeah, one of my favorite subjects. So one of the things there is that there are tools that you could use, and the tools that I showed you with the project assessment matrix, as well as I suggest the if-then measures. We will talk about that as well. And the if-then measures are used a lot by people who do health education. And what those are is that they cover these one-day event, one-day session, the post-if-then measure. And I'll talk about that. And also, I may not have included that in the tools, but if I don't, please email me and I'll send you a copy of the tool itself that is really adaptable and you could use. And we've used that a number of times for single-day events. But you'd have to tailor it to the event itself. And that is something that maybe we can discuss. So at the end of the module, when we talk about measurement, if you could bring that up, that would be great. And then we can walk through that. Does that work for you?
Yeah, excuse me. Thank you, Dr. Telfair. Yes, that works for me.
Okay, great. All right. So any other sessions, questions that people may have? Okay, so I don't see any more. So I will then proceed with what we're going to cover. So we're going to start with an overview of the fundamentals of monitoring and evaluation. And this will be, we've already had a question about this. And what we'll do is we'll cover that. So, all right. So I would just say, feel free to raise your hand or unmute yourself as we go along if you have questions. So the first question we always have is, when should you start a monitoring evaluation process? Our recommendation always is start as soon as possible. The reality is that that is not always the case, as many of you know. We who are evaluators are very much accustomed to the concept of the idea that you jump on the train while it's already moving, which essentially means that the project is usually already up and running anywhere between 6 months to 2 years. If it's a 5-year project, if it's a 1-year project, it's generally 3 to 4 months already up and running. An evaluator was not involved necessarily in the conceptualizing of the application or the work itself. So we know that, and that's part of our reality, part of your reality. And so what we would be able to do is to have you to think about how best to really make that work. So, but our recommendation strongly is to start as soon as possible. And then the best time to do this is before you implement the initiative, to think about how you're going to measure or assess what it is you're trying to do. You really want to be thinking about this beforehand. You want to be anticipatory as best you can, because one of the things that's definitely going to happen is that even if, and this happens many times, and you'll hear me repeat this, many times when you're applying for or responding to a request for a program or a project, be it a multi-year project, be a 1-year project, be a short project, there are going to be times when the person who is the funder or the source of the funding does not ask for you to provide a means to assess what it is you're doing. It does not mean that they do not expect that you will have some assessment. It's just that they themselves may not ask that. Our recommendation always is to think about it beforehand and be prepared, because they may ask you for this in some way, shape, or form. This is why the jumping on a train analogy is because many times it's not even you who have not thought about it. It's also the funder who looks at your work or thinks about your work and goes, oh, by the way, it would be a good idea to know how stuff worked. So I would just say be prepared, and for every project that you do, particularly projects you have in the short and the long run, you have some type of the monitoring evaluation already set up. And evaluation is more than just finding out if you did the job or not, because really what you want to be able to do is you want to be able to ask yourself, in both the short and the long run, to think about what it is that we are trying to do. So what is the reason you're doing the project in the first place? So you have your immediate or your proximal reasons. You have things that you want to do in terms of intermittently, in terms of the work itself, and then long run, what it is you want to accomplish. So think about evaluation and monitoring evaluation is not just finding out the monitoring bit, which is it working the way you should, but think also about how important, particularly for the type of work that y'all do, how important it is to have a good sense of whether or not the difference you're trying to make, the work you're trying to do is effective, is carrying out what it is you have, but at the same time, is it improving along? And then what can you learn from the work itself? So not, is it working? Yes, that's great. You should know that, absolutely. But that's necessary, not sufficient. What you really also want to know is what was learned, how can we improve, how can we move forward with the work in the initiative itself. So when you're thinking about how do you put together a monitoring evaluation plan, there were 4 main things, and a lot of what we're going to cover over the next couple sessions here are going to be this work itself. You want to be able to first clarify your programmatic objectives and goals. And what I mean by that is that be very clear in terms of what it is you want to accomplish, why you want to accomplish what you want to accomplish, how consistent is what it is that you're thinking about what you want to do with what the funders or the people who have expectations or the stakeholders have for what it is you're trying to do. And what that, and to know that there is a difference, and we will go over this, between goals and objectives. The goals are the broader ideas, not necessarily measurable, of what it is you want to accomplish. Objectives are what you want to make sure and measure how things along the way. Clarification in and of itself is it's not just you who are your monitoring evaluation person, but it's the team that you're working with, the stakeholders, whatever way whoever they may be they funders, be they other audiences like government officials, like project officials, and so forth, and even be their clients, the people that you are actually serving in the process. It is very important beforehand that you are clear on that, because that will help you along the way to understand how to continue to keep things moving. The other piece here that it's really important is that whatever you're doing, goals, objectives, you want to really make sure that is consistent with your philosophy. We talked about this when we talked about program planning. And what we mean by the philosophy is what it is that is the reason you exist in the first place. What's driving you? You may be one of 4 different programs that focuses on persons who are, in both in poverty or who are suffering from HIV and AIDS, or who in our current time are dealing with the residuals, from COVID. Be it financial, be it social, be it physical, and so forth. You may be one of multiple agencies, but your reason for existence and why you're serving and why you're doing the work you're doing, it will have commonalities, but there's going to be unique elements to that. It is always important to keep that in mind when you're putting together your goals and objectives. The other thing that you want to be able to do is make sure that you are clear about what it is you want to evaluate, and you want to make that difference. So the evaluation questions themselves are critically important because they allow you to answer what to measure. They allow you to make projections about what it is that you're trying to get at, and now will allow you to make an assessment of whether or not what it is that you're focusing on is going the way you should. The other part of that is that you're looking at, there's short-term or summative evaluation questions, which are the ones you just answer one-off. And then there are those that are what's called, formative, which are long-term questions that you answer multiple times over the length of a project. Because some projects are short-term, some projects are long-term. You really should be able to take time with your team, take time with you and leadership, and to figure out what are the questions, be they summative, be they formative type of questions, and that is dependent upon the type of project that you have. If it's a one-day project, then what is the purpose of that one day? What are you trying to accomplish there? And if it's a one-day project in particular, is that one-day project a one-off project, or a one-day project that's part of an ongoing series of one-day efforts? If it's a one-year project, same question, 5-year project, same questions. So evaluation questions are critical because they allow you then to have a focus and allow you then to be able to look at and answer questions along the way. You also should have linked to those questions, the methodology that you want to use. And the methodology we will talk about and walk you through it is how you want to do that. And we had a question previously about what data to collect. Well, data collection is one part of the methodology itself. The approach that you have is all the things that you're trying to answer on how to make it work. So are you doing observations? Are you doing interviews? Are you doing both a combination of the two? Are you doing surveys, and so forth? And then within those, are you doing just closed-ended questions, open-ended questions on the work? And then your type of data, is the data itself just concrete quantitative data, or is it qualitative data, or is it a combination of the two, and so forth? And we'll talk about all of those structures and all the ways that goes. But these should all be linked very clearly to your goals and objectives, to your questions, and then your methodology. The other part of the methodology, of course, is logistics, is the ability to carry the work out and to ask the question. So if we go back to the question that was asked early on about one-day projects. Well, one-day projects is a good example of the question, is this effort evaluable? Is it something that we can actually evaluate, or do we have to come up with another way to assess that? And that has to do with that. But another part of the evaluability question, which is really critical, is that does the program or the service have in place clearly stated goals and objectives and clearly stated intents that they're trying to get at? So if you're providing services, say feeding persons, a food program, and the program is designed to feed persons, are you just carrying out the feeding part of that, or did you also then have overarching goals and objectives for the type of people you're serving, for the amount that you want to carry out with them, for the time frame, and all those kind of things? What makes it evaluable, is that? And if it's not, then what do you need to do to take a step back and say, how can we begin to create the infrastructure that allows us to make this service or this program something that we can actually evaluate? Because people who are supporting you, be it the stakeholders, are going to ask that question, and you as a person in leadership are going to be asking yourself the question as well. And here's one of the other reasons why. Goals, objectives, the questions at monitoring and evaluation questions asked, and methods are all part of the bigger picture, the planning. We talked about planning last time in creating programs and services. And it's really important to know these things, because one of the things you want to be able to do is setting a timeline, for the existing of these programs and services and these activities and the work that's done. Because what can happen a lot of times is that you can, in your efforts to do the work you're doing, have way too many programs and services to the point where you kind of lose track of the effort, and you don't have clearly stated ways to assess them, and you find yourself, asking yourself, do we keep, or do we toss, or do we modify? Just like in the planning process. And the only way you're going to be able to do that is you need evidence, which you've done, which you built through your evaluation process. So should you have a monitoring evaluation plan? Absolutely. And is it relevant to you being able to make decisions as in leadership about critical decisions about programs and services? Absolutely. So being able to put these four things together in the context of the planning, in the context of systems change, we had a lot of discussions about before, allows you then to make decisions, critical decisions about what it is that you really are trying to do. So let me reiterate a couple of things, as we move forward, just to make sure we're clear. So the first thing is to clarify your objectives and your goals for your whatever initiative or whatever work that you're trying to do. What you want to be able to do is really answer what are the primary or the main things you want to accomplish, and how you want to set out accomplishing them. That is something that you as a team, you as a leader of a team, or need to be able to answer. And it's really highly recommended that you try to do this from the outset. You try to think about the work itself, because a lot of times we've all been in a situation where we are so busy doing the work that we do that we kind of lose track of why it is that we develop a program in the first place. The other reason is that we also have to really take a step back and look at programs that have been around for a bit, program and service been around for a bit, and to ask, are they still necessary? Either necessary in terms of just absolutely necessary, or necessary in the way that we are conducting them, or do we need to make changes and modify? In our day and time, that is really very, very critical. So think about modifications that you really need to do. So if you are a person that you are in, not only just medical service, but community services, where you're doing recreational type of services. So then, something like COVID hits, and the way that you've been carrying out recreational services and groups and other things will need to be modified. How do you need to modify that? And how do you need to be able to do that so that health and safety and other concerns, are being able to be addressed? And so that means looking at your goals and objectives and doing some modifications to that. So the main things is reviewing that, going back and thinking about how it is you might want to do that. Then clarify these ways that will help you identify the kind of work you have. Because one of the things that happens particularly because we carry out at work and we do many of the same things pretty much from day to day, is that we actually lose track, of identifying major program components that needs to be looked at. And the question becomes, what are the levels of assessment that we need to do? Is it simply just saying, did someone participate in the program, yes or no? Or did someone participate in this program or service, and at what levels did they participate? And are they getting out of it what it is that we intended them to do? So clarifying and identifying major components and how they should be evaluated. And one way to do this is to make a table of the program and components and the elements. And we'll show you how to do that in the program tracking matrix. But I want you to be thinking about it early on, because the more organized and structured you are, the more straightforward and easier it will be for you to make decisions about carrying out this work. And of course, as we mentioned in the last group of sessions, this is all part of a larger program and services. So the planning then is going to be a critical part of the early thinking around monitoring and evaluation. And so what do you need to consider when you're doing the planning that will be integrated and involved with things that we've just discussed? First of all, it's planning and implementation issues. So it's you thinking about the logistics of how you're going to carry out the work that you're planning to do and how you're going to do that assessment. And then an assessment of the objectives of the program. Because remember, the goals are just where you want to go, ideas you want to go, but the objectives are going to be the things that you actually measure. And then the measurement based on the outcomes and then the impact or the effect on those who are your constituents or those who participants in the program itself, as well as the broader picture of the community that you're also going to impact as well. And we'll talk about those things, but I want you to consider these early on. So setting up the objective. So when does the evaluation begin? As I said before, it's very smart to start from the very beginning and think about it. And then so outline questions for each stage of development of whatever it is the program you're going to have. The key evaluation questions, the type of things you're going to measure, the type of data that you're going to collect, and then the monitoring evaluation approach or type you're going to use. And we're going to cover all of that, but I just want you to be thinking about this, and what activities you have, because particularly around monitoring evaluation approach, because that has a lot to do with personnel, with logistics, with resources, and everything else you're going to be needing. And so the setting up part, again, is that when you need feedbacks, and reports need to be provided. The thing is that evaluation itself is not just simply carrying the work out and then gathering data and writing a report. You also need to be thinking about who the report's going to go to, who's your audience, for that in the assessment. Now, this is important because even this influences the thinking that you're going to need to have in terms of the actual evaluation itself. Because as you think about who your audience is and who it is you're going to report to, how you structure the monitoring evaluation is going to be critical because it influences the type of data and information that you're going to be gathering, and then how that's going to be analyzed and how that's going to be put together. And then the persons involved at all levels on this one, I really highly recommend that a lot of times to make sure that your staff or the people that report to you, are very much kept in the loop. And very much kept in the loop, and for a number of reasons. One of it is that they're the ones that are most likely carrying the work out, the monitoring evaluation out. They're also the ones that have a really good understanding at the ground level, at the front level, of the constituents that you're working with. And they also are going to be the persons that will probably be able to give you some good feedback based upon the findings, such that you can make decisions on adjustments to the work itself as you go along. And we forget that, but it's critically important. Also, the people who are the stakeholders, those that have investments in what it is that you have, and make sure that you are providing them with the information that they're both asking for, and you anticipate, and I'll repeat that again, and you anticipate they might need to help them to make decisions. And so that's important. Now, we're going to go over this again, but I want to kind of get you to think about it, is that when you are thinking about carrying out monitoring evaluation, there are different stages of the assessment itself. So shortly after the end of a project is generally when the monitoring evaluation will stop. However, you do have other periods of time when it also works. So usually you have a proximal period, which is the first stage of the work itself, to take a look back and see how things are moving. And then you have intermittent stages. In other words, things that are going as the project is ongoing, and you're looking at the information and you're trying to make sense of it. And then, of course, at the end of the project. And it's usually you're still assessing things when the final report is due. Now, if it's an ongoing project, there is no final report. There's just an end of a period report. And so the final report is ultimately when the project is done, but you have end of the period reports that you also really need to be able to pay attention to, and the ongoing work itself. So one of the things that we have to keep in mind when we do monitoring evaluation is that if we have a project, or we have projects or services, particularly services, generally they're ongoing. Generally they don't end. Generally they've been things that are being carried out. They've been modified in some way, shape, or form. So the assessment itself is still viable, and it's still something that you are trying to work on and to make do. So keep that in mind as you put together the project. So the other part of this is what should you expect, from the monitoring evaluation out of this. So a main report, from this work, and I'm talking about the report itself because we're starting at the end and kind of working our way backwards here, but it's going to be the effects of the expected by the staff and the stakeholders in the work that's there. The difference in the outcome on the key participants. So you have services that you provide, and you have a target group of participants. However, as it is in most of the work that we do, be it health work, be it social services work, be it other types of work, not everybody is the same. And so a critical question is going to be the overarching approach to what it is you're trying to do is critical. However, is it providing equity, not equality, but equity? Equity means that it's allowed us to adjust. And have we adjusted the way services are to the unique elements, these aspects of our participants? So outcomes, and the difference in the outcomes, are they meeting the unique needs of the groups that we serve? That's a toughie, to be honest, because just as very varied are persons, varied are outcomes. in terms of the effects of the outcomes. So it's very critical then that part of the monitoring evaluation process is that we pay attention to those. We also need to pay attention to providing guidance for clinical and other applications, and then for further work that we're going to have. So one of the things that we highly recommend in terms of the reports are going to be specific tools like brief report summaries and that sort of thing. Part of what we're going to cover when we cover the program tracking matrix and the program assessment matrix is how you convert those into very simple and straightforward reports that are understood by all persons, be it anywhere from your participants or your clients, all the way up to higher level government, high level funders and supporters and people you're reporting to. And then, of course, the discussion of what was done. So your technical approach that you have, your research work that tools or references, like you'll see at the end of this document, and then the tools that you have. And one of the things that it's really important to keep in mind, and I'll say this now, and I'll repeat it a couple of times. Monitoring and evaluation is not simply a technical process. It is a process that includes both a technical component, a social component, and a political component. And why is that? That is because the nature of the work that we do is simply not just gathering data, analyzing data, giving feedback with the data. It involves dealing with persons. It involves dealing with institutions. Types of groups. It involves diverse types of services. It involves a number of other things. And all of those are okay. So the three elements, and these elements are like a Venn diagram or a different diagram. I should have plugged that into this, but they are overlapping. And depending on the type of program that you have is depending on the size of if you think of them as interlocking squares or interlocking circles, it depends on the size of the square or the circle. Is going to be dependent on the type of program you have. So if it's simply a straightforward direct service program and you just want to know if the service itself is being carried out the way it should, then the technical bit's going to be bigger. If it's a program where you know it's going to require some really hands-on work, it's going to require getting people to participate. So for example, people participating in getting, the jab or the shot for COVID. That's one of those programs you want to assess, but it's going to take some both social and political elements to that. And so that means that those are going to be bigger than just the simple technical bit. Technical bit is going to be small, but the social and political sides of it are going to be much bigger. So monitoring evaluation for the type of not-for-profit work that is going to involve those things. And we'll talk more about that. So we have that. And of course, the frequency of reporting of these efforts are going to be dependent upon, both who you're reporting to, what type of work that you're doing, what kind of program or service you're assessing, and those things. So be quarterly, monthly, and so forth based on this monitoring system. Okay, so that's more of an overview and covering some of the more the critical issues. So I want to pause now and have an opportunity for you to ask some questions. So I'm going to stop the screen share and open it up for you to see if you have any comments, questions, points of clarification that you want to bring what we've covered so far. Okay, anyone? You can just unmute yourself and speak.
So we've at the mediation center attended a few program evaluation sessions in different settings, and we've started kind of it's a federal grant, and it's a prevention based grant. And so I was wondering if you had any tips or any insight about, prevention's kind of proving a negative, right? You're evaluating what didn't happen. And so I was wondering if there was any tools or strategies that might be helpful for something like that versus like a tangible product, like how many vaccines were delivered.
Right. So the focus, thank you, Mr. Roy, that's a very good question. So the focus is that if you go back to the thing we talked about earlier about what it is you need to have in place, which are evaluation, think about your goals and objectives and your evaluation. So where you start is you start about what are you trying to prevent in the first place? If it's a prevention project and you're focusing on maybe what is it? Can you just give me an example of what you're trying to do?
So it's actually, it's targeted violence and terrorism prevention. So it's preventing identity-based violence.
Okay, all right. So if that's what you're trying to do, then it's important to start with what is it that you know, right? So you clearly wrote the proposal based upon the evidence that you had in hand, things that you know that you're dealing with in these areas of violence prevention, terrorist prevention, and so forth. And there's a database of information that you have. So you think about that information, you think about what it is that you got to prove to do and why you got to prove to do that. So those are all the elements that you have in terms of the planning part. If you go back to what we talked about last time around, planning, setting up the program itself. Now, the next thing is that so then you ask yourself, what is it that we're trying to answer based upon what it is that we're proposing to do? So, for example, if in violence prevention you are targeting, and I don't know your program, so I'm just going to speculate and give you an example, if that's okay. So if you have a targeted group, say young persons, and these young persons are at risk to get involved in that work. And so the question is that you have in place a mediation effort with them. And so what you're trying to get at is that, based upon the previous work of the mediation and based on the current work of the mediation, are we making a difference in terms of reaching our targets to see a reduction, in the at-risk behavior that these young persons are trying to get into? And so what we're assessing is the actual intermittent outcomes, the reduction of showing this work. So we have 100 of these young persons, and we know in the past that the level of at-risk behavior they've engaged in has been, if you have on a rating scale, it's 1 to 10 or whatever. And our intent is to bring it from the 9 that it is now to a 5, knowing that we're not going to eliminate all the behavior, but we'll at least have a reduction in behavior. How are we doing? And so you set up a program that allows you to either intermittently do that assessment, like every 3 months, based on your work or whatever. And it should be designed in such a way that it fits the way that you're carrying your work out. So if your mediation is a group by group, then you have targets based on group by group. You have them both weekly, you have them, quarterly, and so forth. But the point of it is that you're looking at prevention, and you have to say, is it primary prevention? Is it secondary prevention, or is it tertiary prevention? And that has a lot to do with your initial assessment of the critical or of the intensity of the area itself. Tertiary prevention, of course, means that what you're trying to do is just, reduce the amount that's there, because it is going to be something ongoing. Secondary prevention is stopping it in its place. So you actually are just eliminating the number of at-risk routes at all. And primary, of course, is that you have things in place that prevent these persons from getting involved in the first place. So you have to decide what level of prevention you're going to do, what type of program that's targeting levels of prevention you're going to have, and then you design an assessment around that. Does that make sense?
That makes a ton of sense. Yeah, this is really helpful. Thank you so much.
Okay. All right. Okay. So we can go from there. All right. So next questions. Any other questions based on what we've covered so far? Thank you, Mr. Rowe, for your question. Okay, so I don't see any in the chat box, so I am going to go back to my screen. Okay, so the types of monitoring and evaluation, and this fits well with what Mr. Rowe just asked me. We're going to cover that. So there's 5 basic types that are relevant to the not-for-profit groups that are on this call. And understand that monitoring and evaluation covers a whole host of other areas, but most of the work that we do here are in these 5 areas. They're either health programs in general, and health programs in general mean things like psychological programs, like clinical services programs, and so forth. Healthcare systems we mean things like hospital care type of work that is being done. We mean larger foundational work that's being done, and so forth. The health services, the actual direct services that are being carried out, in terms of direct services, which is treatment services and that sort of thing. And then the programs itself could be prevention programs like Mr. Rowe has, but the services are what it is that's being carried out at the level of the services. We have social services program, so we have programs that are dealing with housing, with food services, with general support services, sheltering services, and so forth. And then, of course, we have governmental services that a lot of people are involved with, which are the kinds of things that you would do to deal with the logistics of day-to-day governmental type of carried out, which are based on policy types of areas, which are based upon generally health and human services, but from the perspective of what the government, be it the city government, be it the county government, be it the state government, what are they responsible for in terms of that? A lot of it's fiscal, a lot of it's policy, and so forth. So the scenarios that we are going to focus on going forward are going to fall into these 5 areas. So, however, these are a subgroup, not the totality of the types of monitoring and evaluation areas that we can discuss. And I want to make that really clear. So let me repeat that. These are the sub areas where what we've heard is what you all mostly work in. However, we know that there are hybrid areas that sort of carry over this. For example, environmental health. We know that there's some environmental health issues related to sanitation and other things that overlap with, say, social services, overlap with some of the healthcare services, particularly now, when we're dealing with things like, you keep using COVID, we know that there's certain sort of structural, environmental, like housing, like water, like air, those sort of things. We know that those things have something to do with a person's ability to deal with COVID. And those carry over into the health services as well as the broader healthcare system. So we know that there's overlap. And so, however, for convenience and for instructional purposes, we'll fall into these areas. Now, I mention this because I want you as the participants to bring to our attention questions that are in these overlap areas that we may or may not cover. So I just want to bring that to your attention. All right. So, a number of things. First of all, going back to planning. So let me take a moment and talk about the fit here. We talk about laying the groundwork, which is what we did in the last module. But here is the fundamental areas. So what you really need to know when you're trying to put together a monitoring saturation program is what activities, based upon what you have planned and you want implemented, what exactly it is that you're trying to look at and the why. And did you think about the outcomes? And think about the outcomes, not so much as the results, outcome as results, but outcomes as in levels of influence, levels of change, levels of acceptability based on those outcomes. And why do we say that? Is because many times there are challenges that we have in the work that we do, where no matter how hard we work or what we do, we still are not achieving the kind of outcome we really want, because the challenge of itself is really hard. And this has a lot to do with things like, food programs, and trying to, deal with those, try to deal with homeless issue, trying to deal with some of the mental health challenges that we're trying to work on, trying to deal with the health types of issues we have. We know that a lot of those things are here now, and they will be with us for a long time, and that we are only making a dent really in the type of outcomes we have. So we have to make a decision. You as a team, you as a leader, need to make a decision as to what is the acceptable level of change or acceptable outcome that it is you're trying to achieve. Because assessment will just give you what it is that you're asking it to give you. So wherever way you set up this monitoring evaluation program, and whatever data and whatever process you use, that's what you're going to get. And there is not going to be, something that says, okay, because I've had this discussion before with other people, where there's a higher expectation that evaluation somehow, shape, or form is going to show you more than what it is you set it up to show you. Well, no, it's going to show you what it is you set it up to do. And so the decisions, particularly this, because this is tough for you as a leader, you're going to have to make a decision as to what is acceptable, based upon the evidence. And part of that acceptability is that making decisions about change. Okay, so this is what we found out. We found out that while we are able to provide food services to this group of persons, unfortunately, because there are few persons in a subgroup of those persons who cannot access our services for whatever reason, they're just not getting our services. And we're fighting this out, and is that something that because we have limited resources, in other words, and we only have so much we can give out, is that acceptable to us? Or do we need to figure out another way to expand our resources such that we can then begin to provide services to those persons who cannot access us because of transportation, because of physical limitations, because of all kinds of other reasons? So when you're thinking about monitoring evaluation questions, you also need to think about what are the consequences of the decision and what type of changes you need to make related to those decisions. Now, where changes in specific outcomes are due in activities, as opposed to something else. So what if you find out from your program that what it is that you think is going on is not going on either at all or at the level you think it is? So in other words, then, when I say where the changes in specific outcomes due to activities as opposed to something else, I'm just talking about things where you have these unexpected or disappointing results. And it's really a challenge for you, particularly you all who are in leadership, who have to explain to either your staff, your constituents, and especially to those who are funding you or above you, stuff's not working out or didn't work out as we had as opposed. Then what? So that's being prepared. That's being anticipatory. And you should be thinking about this as part of going back to your planning and having those. Other factors prevented the activity and the focus of being implemented as you plan. There are unexpected things that happen all the time. We are living in an unexpected time. We're living in a really serious trifecta of issues where we're dealing with financial hardships that we did not anticipate would be at the level it is, medical challenges based on the COVID and both the Delta and Omicron, and then the new beta the beta that's passed, and then there's a new one that's coming out. We did not anticipate those things. We did also in our health equity challenges that we knew already were there. We knew that there were challenges with disparities and equities, but we didn't know the extent of it until we start looking at these other areas where the financial and the other issues are going on. So part of thinking about these things is part of it is using the knowledge that you have based upon what you've experienced and based upon what you anticipate to be able to look at things that are going to interfere with in some level what you had planned. Because there is no such thing, and we've said, and I've said this last go around, and I'll say it again this go around, there's no such thing as a perfect program. Things work out exactly as you planned. And there's no such thing as magical data that will allow you to make it look like things work out the way you planned. So if there is, then will be the first to say I was wrong and be the first to apologize. But I can tell you, in my experience, there's no such thing. So that means be prepared to have things not work out exactly as you have planned, and be prepared to make decisions on how you're going to deal with that. You all do this all the time. This is how you live. You know that. So the inputs and then the moderating factors, what are the things? That's why we have, what were those things? What were those inputs? What were those moderating factors? Those things that made change, that changed what it is the outcomes look like. What it is that are there that were responsible for the kind of things that you saw when you carried out the work itself. And then, can you do something about it? So what factors did you prevent, progress based upon what it is you're focusing on? What are the kinds of things, what kind of change you're going to have, right? And then what are the moderating factors that were responsible for that? These outcomes, that the progress in the outcomes, not just the actual end of project or end of service delivery things, but intermittent work that is being carried out. And then if you are going to make those adjustments, which you really should be thinking about, particularly in terms of being able to both the longevity of whatever program you're trying to do, and in your ability to explain to both staff, to stakeholders, to those that are supporting you, and particularly if it's something that's related to government, where you're constantly under the radar, or under the constantly under the radar and constantly under the microscope, if you will, for stuff to work out, particularly in tough times. Then being able to specify those things that are moderating that. And then the other part is that being able to use this information in such a way that you can make concrete, actionable recommendations that can be carried out. And carried out. And what I mean by that is that there are going to be recommendations based upon findings of things either working out or not working out that you would like to see and you'd like to recommend and so forth. Some of them will be things you can actually carry out because you have the resources to do that. And others may be things that you have, on your bucket list or your wish list or the things you want to do. You will be in a position based upon the evidence that you've worked on so far to be able to make those decisions. So that means considering what is the cost for implementing the activities and the things you want to do. So actionable recommendations that are linked to doable, cost-efficient ways are going to be the first thing that pretty much anybody's going to ask you to do. It does not mean you can't be creative. It does not mean that you cannot come up with ways that you think will work. But your monitoring and assessment system is going to provide you in such a way with that information. Now, the caveat there, and I want to be very clear on this, the caveat is that the monitoring evaluation system is only going to provide you with information about what it is that you're actually measuring. And I'm going to repeat this at another time, but I want to keep that in mind. So you need to be very circumspect about what it is that you're trying to look at and measure, and be very, very clear about this, which is why I said to you in the very beginning, be clear about the goals and objectives you have. And it's why in the last session, when we talk about planning, we talk about using your evidence, the experience you have, and your ability to be anticipatory in that work. Because you're going to have to, at the end of the day, based upon all this evidence and all this work you have, at the end of the day, you're going to be asked, what are the cost benefits and cost effectiveness of these outcomes that you either were achieved or what you're trying to look at and trying to achieve. And so whatever evidence you have on hand, based upon your monitoring evaluation, is going to be used. So that means that there is in our work, sort of unfortunately, there are competing recommendations. And I'll be honest with you about what those are. One of the recommendations that many evaluators say is don't collect data that you're not going to use. And that's a sound, solid recommendation. Another one, though, says that, well, because of the type of programs that you all work on, that in and of themselves are varied, that in and of themselves have things that you can anticipate and things that are going to be, serendipitous that you may not anticipate, that you should give yourself a little wiggle room to look at things that you anticipate you might want to use, you might want to need. Now, how do you make a decision on those two for some middle ground? Strong recommendation is to have a deep discussion with your team, yourself, first of all, your team. And if you have an evaluator that you're talking to in the beginning, talk to them about that. Because then what you could do is you can then narrow the scope of the things that you think you might need, as opposed to the things you have to have. And that narrows down the amount of data you collect, but it also allows you, as you are now looking at the end of your work, your outcomes, and you're trying to assess that, it gives you a little bit more to work with in that room. But it gives you a little more to work with in such a way that it's been very well thought out, very well planned, and that it's focused. Because the risk, of course, and we've been involved with these types of programs all the time, is where there's a plan to collect a lot more data than what that is being used or will ever be used. That is the mistake that happens. And so we recommend a lot of times is that if you think you're going to need data over and above what it is that you have planned, what is linked to your program or services, then really, really be circumspect and think through what that might be it demographic information, be it service delivery information, be it that you've read the tea leaves and you think politically there are going to be some things we probably really need to have, so on and so forth. So about that. And then the last thing is that, okay, think about if you're going to do those things, all of the bullets that we talked about so far, what are the cost benefit, cost effectiveness of the outcomes you're trying to achieve? Or is it going to be that way? That's not the only thing to think about, but it's important to think about it because of the type of work that you do as not-for-profits. You're going to have to think about those things. And I'm not talking just about financial cost benefit or cost effectiveness benefit. I'm talking about other general resources like staff, like considerations by this. People who are going to participate in your program or your services are thinking, what is it that how I'm going to benefit from those or not? So when y'all are thinking about these things, you think about also the social and psychological elements that are as involved with your program or not. If you are in charge, for example, with a HIV/AIDS service delivery program, not just in terms of the treatment side of it, but in terms of the other sides of it, well, getting people to participate, doing the follow-up support services and so forth, people are making either short-term, long-term type of cost benefit assessments for their level of participation in these programs based upon their experience, based upon what they think are going to be outcomes of the work and so forth. So you all know this, particularly if you do any kind of service delivery related to clinical care. Even participating into other types of services programs like home programs. You're trying to find people to find places to live. They're going to be making decisions with you, on that based upon just time they've been homeless, the scope of the size of their scope and of their need, the size of their family, so on and so forth. They're all making these decisions. So we who work in not-for-profits arena are always having to make and work with people who are having to make decisions based upon their individual and sometimes group cost benefit, cost effectiveness. And when we who are providing these things also need to make those decisions. So your margin evaluation program linked to your plan have to have these things in mind. All right, now, so what is it that means? So the types of margin evaluation programs then is that they do necessarily do they involve a formalized evaluation schedule or set of procedures, but it allows for the assessment of whether or not an intervention or program or service is. And these are the kinds of things you think about. Is it operating in conformity to its design? What do we mean by that? What we're trying to get at is that you have thought through a program or a set of services that are linked to what it is that you see as a need, right? And based upon that, and based on your philosophy of carrying out services, the way you approach services, based on the planning that you've done, based on the input that you've gotten, we're trying to assess if the program is being carried out the way that all of these things have that. So if you're saying that we have a program that we're providing both clinical and physical clinical services, which is, in a health program, clinical physical services, and that we're linking those clinical physical services, say for someone who is in, having the unfortunate situation where because they've been through opioid addiction, they're now suffering from organ challenges and organ damages. But at the same time, while you're treating them for those physical illness, you also have to think about how you also going to work with them in terms of levels of prevention, in terms of their opioid addiction, and in how those things are going to be linked together. So conformity, then your program is designed that there is a clear link across those. So you're providing this wraparound services to this person or persons or group of people. And then all those are working the way they should. Are they linked together? Do you have the right personnel in place? Do you have the right services in place? Are people participating as they should? So on and so forth. So your assessment is going to be whether or not the conformity of the IFRAD itself is being carried out. So that's a big element. Reaching the target population, really tough in terms of that. Some of it is pretty straightforward. If they're being treated for a physical ailment of one type or another, and you are a clinical, a physical clinical services, agency, then like a FQHC. If you are one of those and that's what you're doing and you're treating them, giving them medical services, then that's generally pretty straightforward for the most part. However, if they are a complex person, like most people are, and they have both the medical services need as well as the other types of psychological and social needs, then identifying the population in such a way that you are addressing those is a real challenge, because your population is not straightforward. You're not just dealing solely with males of a certain age in a certain area or whatever. You're dealing with males that have a family, males that have a history of violence, males that have a history of this and that. And so now it becomes complicated. So defining your population is not as easy and straightforward as you might think. So and that's an assessment issue that you're going to have to deal with. So what does your sample look like? And many times in monitoring evaluation, you may have to define those in order to be able to get support and funding for what you do. So you define them in a generalized way, like, for example, at-risk males, for violence would be, a general category. But then you have these subcategories that you're also dealing with and that your program has to also address. So your population needs to be defined both generally and levels of sub-specificity, if you will, that allows you then to be able to measure and assess what it is you're trying to do. So the other part of that is that, what are the other process-based questions that you need to answer? So it's not just simply saying the outcome of this work is that we have reduced the number of people who are homeless, reduce the number of people who come to us seeking, food services, or the number of persons, who come to us who no longer has or are dealing with these sort of environmental health types of issues. It's more than just that. It's like, how do you get from there to here? So you can choose to just be summative. In the summative an assessment, you're just simply not looking at shots in time. Here's, based on solely outcome assessment, and all we're looking at is, is there a change between A and B, or change between A and Z, and so forth. However, that is not the reality that we who work in not-for-profits do, and not the reality you as a leader have to do. You have to be able to answer the question and the intermittent part, because there are persons and institutions, agencies, clients, so forth, who are asking you to think about those process type of thing. So being able to think about process-based questions on that one. Now, the piece here that we talked about in planning is the components of the actual program itself, or the service itself. And what we're talking about is linking those components, those program components, those service components, with the levels of consideration of why they exist, are they working, and so forth. All those things need to link together. And those two linkages means you're linking the program itself with the assessment of the program. So you have an overarching assessment of the program as a whole, homeless program, and then you have sub-assessments based upon families, single women with children showing up at the door, single men showing up at the door, whole families showing up at the door, families that are who may or may not speak the language that your service is providing. How do you deal with those folks? How do you deal with persons who are new to the area, who find themselves in those situations, so on and so forth. So consideration then of the process issues, and that is going to be based upon, which is why it's so critical. What did you already know when you put together the program, and what are you learning as you carry the program out? And so the process part is going to be the learning, how you carry the program out, and what adjustments you're going to be done. Because you remember, we talked about before, unanticipated or elements of the program that doesn't work out the way you should, or new things you need to learn. Okay, and so those are really critical. And then the other piece here, and it is going to be a focus on the recipients themselves. The persons who are in the program, who are your clients, and who are that, and also the recipients themselves are going to be the clients, but also the other stakeholders that are going to be involved. So I want you to think about that for a moment. And what we're going to do at this point is, because of the time, I'm going to come back to this question, but I wanted us to take our first break of the day for 10 minutes if we can, and come back. and then let's finish the conversation here. I know, and think about questions you might want to have, because we do have a section coming up around questions, but think about this one and take a moment, take 10 minutes break, and then come back, and then we'll talk about it. Okay, Ms. Roberts? Or Ms.
Thank you,
McConney?
Thank you, Dr. Telfair.
Yeah, could we take a break now?
Sure, we'll take a break. It is currently 11:30, so we'll see everyone back on at 11:40.
Okay, thank you.
Thank you. Dr. Telfair, are you ready to get started again?
Yes. Mm-hmm.
Okay,
All right.
welcome back, everybody. We'll get
Okay.
started. Thank you.
All right. Okay. So we are gonna go I'm trying to break this up so that we are in give you as many breaks based on your comments, but also kind of not too much information. This is this session, I should say, from this point forward, it is going to be a little bit more technical in terms of the information. We spent some time on the thinking part of this, and now we're going to focus a little bit more in this session on the technical bit. So as you think about focusing on your recipients, the next part of this has to do now with the type of monitoring evaluation, which is going to be important because you really to think about what it is you want to do. Remember, and we talked about thinking of the design that you have. So generally, monitoring evaluation methods and designs falls into two groupings. Long-term, like multi-year projects, 2, 3, 4, and so forth. And then single year or single time areas. So most of us, particularly in our area, would like to have and then do work in multi-year program. So these are called formative type of evaluation in general. There's other names for them, but for purposes of these, I will call these that. In research arena, these are called prospective studies, but in the evaluation arena, formative or long-term or longitudinal type of projects are called formative in general. And formative means long-term. It's another way of saying long-term, needs are going forward and so forth. So they can fall into different type of subcategories. Believe it or not, needs assessments, which are repeated every couple years or so, fall into these type of things, or diagnostic assessments, which are ongoing. So many times a needs assessment is not just a one-time thing. You may need it to do it one time because you are applying for support or funding. However, it's repeated. And so it's important that you have monitoring assessment data that is updated on a regular basis. So a needs assessment that is not updated is not useful to you or anybody else. Diagnostic assessments where you're trying to ascertain different elements of your program or your service are also ongoing. And so these are the type of things where you're collecting data or collecting information or assessing information multiple times within a period of time. That's what diagnostic assessments are. And so you all do these things already, you just may not have the label for them. The other type of ongoing formative assessment or the pre-testing that you do, particularly for like communication programs, where what you're trying to do is you're trying to assess beforehand what people's knowledge would be, what do they understand and so forth. And then you are preparing the program based upon that of what you might want to do. Now, there's a pre-testing and then there's the post-testing goes on as well, depending on this. So the post if then approach, post if then, POST -IF -THEN, there is a way to assess this if you have a one-shot program, and I'll talk about this in the summative. But pre-testing in general is used to assess, where you are at the beginning of a program, and then what you want to know going forward. So monitoring of a service is part of that. Service utilization is that. And I'll talk about the difference between monitoring and evaluation in a moment, but just know that monitoring is what you do when you have ongoing work that you have. And then of course, monitoring of health behavior or health status is self-explanatory because you have that. And then of course, every process evaluation or process evaluation is a formative type of an approach. And process evaluation actually focuses on answers the question whether or not a program is being implemented the way it should or as planned. And there's a lot to process evaluation. We unfortunately Will not get a chance to delve into it as deeply as we can with this training, because process evaluation is a course in and of itself. But I just want to bring it to your attention that it's part of that. The other term that is used a lot is summative, or the other type of evaluation and monitoring evaluation is summative. And what summative means is generally outcome evaluation. You may have heard that term, outcome evaluation, on that one. And in the research arena, it's called cross-sectional, which is one shot, one time thing. But summative means that you are trying to get at outcomes, and the outcomes you're looking at, be they intermittent outcomes, which are short-term, or impact assessment. Now, going back to one of the questions we asked earlier, so an outcome allows you to assess in the short term or the immediate term, what is the results that you have. Impact assessment is more long-term. Impact assessment is generally not done for a program or service unless it's been going for several years, 3 to 5 years, and so forth. You can look at outcomes, just look at them like what we have. In our arena, because we work with a lot of government agencies, a lot of times government agencies only give you a year to assess efforts, and they want to know change that has happened over the past year. Those are generally what we call intermittent or short-term outcomes, because particularly around behavior and health status, it's really a challenge to figure out what is really changed in a person or a group of persons within a year. So the recommendation always is to set up your monitoring evaluation system in such a way that it allows you to look at short-term adjustments or short-term changes or summative assessments or outcome assessments, and then put those into a more formative or process-oriented type of assessment. And we'll talk about that as well. The other part, of course, is that when you're doing a cost effectiveness, which generally a lot of people do from year to year, and because that's the way a lot of financial things are set up, is that they're just monitoring or assessing what was the link between the investment, be it resources, be it financial and otherwise, and then the change that you see within that period of time. So, so that's generally how those are used. Now, the other way, and this is important to keep in mind, the other way that summative assessments are done is that you could, going back to what I said before, as evaluators, we're accustomed to jumping on a train while it's already moving. A lot of times the program will be up and running and has been up and running, or service has been being delivered, and it's had been delivered for several years. And there's been really no formal assessment of either that program or that service. So you can design an evaluation that allows you to get a snapshot of that program or service at that period of time. So if the program has been running, for example, since 2019, and you now are looking at it in 2022, and there's not been an assessment, you may want to just look at where the program is at this point in time, and you could do it so that it's a single over the last 3 months, or this month, or you want to look at it retrospectively. It's always a retrospective look when you do a summative assessment, is what does the program look now based upon what it's supposed to look like. So if the program started in 2019 and you're now being asked to assess it in 2022, then the way you would approach it is that you would approach it from a retrospective area, and you would try to gather and focus on whatever information that's relevant to that assessment based upon what you can gather based on what's existing, in the archives of that program, in the documentation of programs, whatever. Or you could use, just-in-time type of assessment approaches that you have. And the just-in-time program assessment work that you could do are things like key informant interviews, person interviews, focus groups, those type of things. So you could use a series of methodologies that provide you with information based upon the experience, the knowledge that persons who have participated or have been recipients, participating in the program or recipients of the service at this point in time. So you have options is what I'm saying, depending on the program itself. Now, the decision about this is that you as a leader would need to make a call on this. And so what are the circumstances that a lot of times summative programs are done? Well, one of the big ways that it is done is that when you are asked to make a decision, should we or should we not keep, toss, or modify a program? And if you do not have information on that, then a summative assessment will really help you out there. Also, a summative assessment is what you normally do when you do an impact assessment. So in other words, then if a program's been going for several years and you now are looking at how to assess that program at the end of the 5 years, that's what you're doing. You're looking at that. An impact assessment is a summative assessment, but it's a summative assessment of a type. So it's not an outcome assessment. It's really seriously looking at the impact. What is the major change that you've seen there? So all of this, though, you have to make sure you put that in place, and we can address that as we move forward. So some of the things we're going to talk about will help you to better understand those things. So let's move into a few definitions that I think will help here. So needs and assets, which I've covered, is the identification itself of the process stuff that is going on. So assessment, which you're assessing, is the importance and relevance of a problem or solution. So many of you have done needs assessment where you've looked at a challenge of one type or another. You've gathered data, and then you put that data into tables, you put that data into words, or so forth. And it allows you then to answer the question, what do we need that will allow us to get the work done? And not only you to get the work done, but what will it need so that those who are looking at what it is that you said you're going to do now have the information they need to make an assessment of whether or not they should report you or not. And it also answer that. The other point that I want to make, which I think gets lost in the needs assessment discussion, is the asset assessment. And so asset assessment in and of itself incorporates, where needs are, but however, the difference there is that it allows you to say, here's what we have in place that we already are using that will either be enhanced and or is in deficit of what it is that we need support for. So in other words, then, if you are looking at a program, say, that is providing, an FQHC, and the FQHC has a whole list of clinical services that it provides. However, it now has the personnel in place to provide these types of clinical direct services, but the number and the need itself is grown. So there's more requests for certain types of clinical services, and it's stretching the personnel that's in place. So the need is going to be based upon trying to assist to enhance what is already there, because the asset is you have competent persons and you have resources, but it is not enough. You need more. And so assets gives whoever is looking at your program and in the information, it says they have in place competent persons, they have in place resources, but what they really need is a way to enhance those things. And or you are now being asked to provide a new clinical service, a new diagnostic service, a new type of treatment. And while you have in place personnel and some resources, you now are saying, well, if we're going to do that work, we know that we're going to need more of this, more of that. And that's based upon our data. So when you present information or present an assessment, of what it is, you should think both about the needs as well as the assets, because it's the long term that you're doing, because you're building assets based upon the programs you have. You're addressing needs on there, and what you look at when you are talking about this assessment, it allows you to then look at what the gaps are, and that's what we're talking about. It's a gap question. It's not so much as to the always there. The challenge that we have all the time is that we unfortunately focus mostly on the needs or the deficits, because that's just the nature of what we do. However, if we're going to look at improving things like equity and access and dealing with disparities, we really do need to focus on assets that we've built over time and how those assets can be enhanced, and work to do that, and that we can focus on those elements of that, because that's what we're advocating for. And you can use the data that you have for those reasons. So I would focus on that. So by definition, then you have that. The other component here is understanding how those are done or how it's looked at. So program monitoring, is really important. So I want to really make clear here the difference between monitoring and evaluation. So first of all, by definition, monitoring involves assessing progress toward accomplishing whatever your goals and objectives are, either for the program or the service. That's what monitoring is. And monitoring is a subcomponent of an evaluation. Monitoring leads to an evaluation. The other thing monitoring asks is, to what extent is the process being implemented? The other piece of this to keep in mind is that you as a decision maker, as a leader, need to decide, if I'm looking at instituting a monitoring evaluation program, do I have the resources to do both, or do I need to do both? Because sometimes all you need to know is simply, is a program working the way it should, or the way it's planned, or the way it's implemented. And you put that into your thing, and monitoring, and you stop there. You don't ask change questions, you don't ask other things. That's perfectly fine, because a lot of programs and a lot of services are simply asking that. And all you're doing is just observing over time through the formative process how a program is working. So that's that. And so that's why it only asks that question. And so it's a decision you have to make for this. Majority of us who work in the evaluation arena suggest that you consider developing and working on things that are both. Now the dictation of the program itself, like for example, a lot of the services, or a lot of the programs that fall under the Healthy Savannah require that you have a formative approach, that because these are multi-year, period type of efforts. And so they require both monitoring and assessment of change. And so that assessment of change then, by definition, is an evaluation. So you only, to be very clear, you only evaluate programs that in and of themselves have a focus on outcomes, on that. If the program is simply there just to assess whether it's working or not, and you answer that question yes or no, then monitoring is all you need. But if you really want to know whether there is a systems change, whether there's an outcome of any type, change of any type, so to be very simplistic, evaluations are used to assess change. Evaluations used to assess change one way or another. And so the type of evaluation that you have depends, depending on the change you have. I will probably not be able to go through all types, but I'll go through the ones that are most relevant to you. So by definition then, evaluation relates to the activities that are there, the information that allows you to assess change overall, ongoing, and eventually our outcomes, and eventually impact. And generally it's done for the purposes of accountability and policy assessment, particularly if you work in government programs. So evaluation answers these outcome-based questions. Did the program or the service make a difference? As opposed to, is the program or the service working the way we should? It also asks what changes were made or observed for seasonal services. So you're looking at both what we call intermittent outcomes, and eventually those services, did they receive or not impact? So intermittent outcomes lead to impact. So that's why when you all who are into logic models, that's why logic models are structured the way that they are: goals, objectives, intermittent outcomes, and eventually impact. So evaluation is what you use for that. So depending on that part, so formative evaluation then refers to ongoing or longitudinal activities, as I've said before, and it allows you to have information for decisions being made regarding the improvements other refinement or ongoing programs themselves. And what you're thinking about when you're in your planning process is the design of these efforts themselves. So if you have a program that is a multi-year effort, then it's a prevention, say, program, or it's an intervention-based program, or it's a clinical services or a service delivery program, those type of things. What you really want to know is did it make the change that it had? So let's take a program where sometimes you're not quite sure. Let me give you an example. So take the example of a food service program. So the food service program that some of you have are ongoing, and basically you are finding ways to make sure that people's food needs are being met. That's ultimately what you're trying to do, and you could do that easily by simply assessing whether or not the amount of food you're giving out is being used by the people you've targeted and in the way that you've targeted them. However, if you want to ask, are you seeing changes in the person? In other words, then do you also see that the improvements? You see that the food that you're giving people out, because part of your intent is that they also themselves become, they become, less dependent on you and more dependent on other things. Are you seeing that as well? So if you're feeding them on a regular basis, are you also seeing them begin to use your services less and do other things? Now that is dependent, of course, on it could be dependent on the economy, depending on other types of work, depending on their access and their activities. Or you could ask the question another way. You have targeted a group of a population that based upon your research and your background and other things, that really need food services, but they're not accessing the things you're giving out. And what you want to do is you want to see change. You want to see change in such a way that these folks, are accessing that, and more of them are reaching out to you for the services that you have. That's an outcome type of question. Whether or not you're delivering the service as you plan is a monitoring question. The outcome question is whether or not you're beginning to also see change, whether change in increase in access, change in improvements in their lives based upon the work you're given and so forth. So that's kind of an area that sometimes it's hard to determine, but you could really see that that's where that. So one of it's monitoring, one is evaluation, or you could do a combination of the two. So it depends on your goals and objectives. You could have monitoring objectives, you could have outcome objectives. And that really is on that. And we'll talk about that in a second. So related to the provision of information is decision being made regarding improvement or refinement of your program or your service. And then based upon the way you planned it, if the implementation is being tested in such a way of that. And so maximum effectiveness is a term that I use because that's honestly what it is you're trying to do. You're trying to make the biggest impact or the biggest bang for your buck that you possibly can. And the biggest bang for the buck means that you are now being able to figure that one out, independent of what the program is targeted for or the service is targeted for. However, you need to be able to look at this because part of a formative evaluation process also allows you to ask the critical question of those critical questions that I mentioned before, keep, toss, or change. And that is critical for us who are in this arena as leaders because of what I said we were talking about before, which is when you have a lot of efforts, and those are ongoing. The other thing that I want to mention here is that a formative evaluation allows you, in terms of decision-making, to discern what can you realistically go after in terms of support and services. So there might be a lot of RFAs and things like that. And we talked about, and remember we talked about when we talked about grants, the type of grants you have. Well, some of those realistically are not in your neck of the woods, because you do not have either the resources, or other types of thing to go after them. Some of them may look like they do, But based upon the information that you have, you're not ready for those. And then others, for the most part, are ones that you really think you have a realistic chance of getting and going after for all kinds of reasons, whether people are offering you to go after this from that end to the other end where they just look very promising and that you think you have enough in place to go after. So formative evaluation of similar programs and other efforts, or even applying those to programs that you have and services that you have, is that. And it allows you to ask which works better, but also what do we have in place to do. So by definition, then you have that. So further around this is the process evaluation part. And process evaluation then, as I mentioned before, refers to activities that allows you to identify. So it's a type of formative evaluation, but it sort of asks the question, the appropriateness of the services, the program, or the intervention. And it answers a couple questions that I think are that you all can understand. So what services are actually being delivered and to whom? Is the program happening as it does? Is there a problem with design? Is it working as it planned? And is there a difference over time? So process evaluation allows you to integrate both monitoring and evaluation in a longitudinal or long-term way. And that is ideally, or sort of one of the ideals, I should say, evaluation approaches that works for a lot of the bulk of what it is that you all do. Because you do want to monitor and ask those monitoring questions, but at the same time, you want to ask that last bullet. Is there a difference over time between the participants in your program and in those that are not in your program for whatever reason? Like, for example, with the food service that we just mentioned a second ago. Okay. So you want to answer then, in terms of the carrying the work out, is that this whole idea of program implementation evaluation, which is a type of formative evaluation, but slightly different, because the focus primarily is on, are changes happening over time? While process evaluation try to ask a broader thing, programs implementation is pretty simple and straightforward. All it really wants to know is the extent to which program actually operates that are consistent with the program objectives, that you deliver, and all these planned efforts showing the change or making the change that you thought they would. So it's part of process evaluation, but it's a slice that simply is getting at, are changes happening over time the way that you had planned it? In other words, are they meeting your expectations? Because one of the things that we all know in addressing questions that comes from our constituents is not only is the program working, but are we seeing the changes that we thought we would see? And we need to do those over time. Process evaluation allows you to answer both, but implementation focus, which is a subcomponent of that, just focuses on, are we seeing the changes? Not as the program working per se, but are we seeing the changes we expect? So if you take the analogy of the food delivery program, and if the intent of change is an increase in the number of persons from the target group that you had. In other words, there may be people who are homeless or people who do speak a language that is not spoken there, like Spanish. And if your intent is to increase the number of those persons who speak Spanish but have a greater need, are you seeing, because you've made adjustments to your program? In other words, you've added persons who do speak Spanish and or all persons who understand the language and understand the culture. Are you beginning to see changes? In other words, those persons utilizing, having greater cultural access to your program than you did before? And then are you over time, are you beginning to see that kind of change? That's what implementation evaluation asks the question for, because it looks at the differences over time. So you're constantly doing this, what it looked like, what it looked like then, what it looked like now, what it looked like then, what it looked like now. That's kind of in your head what you're thinking. And as a leader, that's really, really critical to think about. So that, and then you have a chance now to do and look at outcomes. So outcome evaluation, as I mentioned before, by definition, again, is allows you to assess the overall quality or the impact of the program. And I mentioned this before, that outcome evaluation can be a part of any kind of formative or longitudinal program you have, because what it gets at is whenever you decide, okay, we're going to stop and we're going to ask these questions. Did it make a difference? Did what we make a difference? So if the program's been going for a year and you only have one shot at assessment, then your question is, did it make the difference we intended it would, given it that we're doing this one shot look? And then were immediate changes, did the clients or the participants, do they agree, that these things are happening, or do you see the changes in that? So if we go back to the analogy related to persons, who speak Spanish, who need food services, and we've now done some adjustments to our program to allow for greater access to that population. Are we really seeing the changes in the clients, that they understand the program and they're using those in a way that makes a difference, that has made the difference? So that's kind of what you're looking at there. And so that's what you're looking at in the stat. So you could use in this summative or outcome are generally looked at, at different slices in time. If you want to know in the long run, if the program is making a difference, then the thing you look at is impact evaluation. And so this is a special type of summative, as I mentioned before. However, it's one over time. So it's ultimately what you want. So these are the activities that information allows you to look at like a 5-year, a 3-year assessment, a 5-year assessment, a 10-year assessment. Those are impact assessments, right? Because in the interim, what you're looking at is just sort of every 2 years you assess. Well, those are the summative, those are the outcome things. Those are intermittent, every 2 years, every 1 year, and so forth. If you're in government agencies, while I know the term impact is used, it's not, and I would so humbly say it's not used appropriately if you're only looking at a program after 1 year. You really want to know that doesn't give you enough time to look at all the components of a program, because most likely if it's a new program, it takes about 3 to 6 months just to get up and running. So a 1 year assessment is not enough. Well, even if it's not a new program, looking at it from year to year, is that, unless you look at it cumulatively. So what an impact assessment allows you to do is look at the cumulative difference over time. So it answers the same question. Did it make a difference? However, the interest is ultimately what it is you're trying to do. What is the longer term change that you're looking at? So if you have a financial assistance program, and you have a population that you've been serving in this financial assistance program, you can look year to year to see, whatever targeted changes you've had related to your goals, objectives, your monitoring evaluation questions. You can look at those year to year. But what you really want to know is that the real change is you're going to look at change lives over time. It's changed lives, yes, but change lives over time is important. Now, I know that particularly if you work for government agencies, because there's so much pressure to show immediate results, for quarterly results or biannual results and so forth, I get that. However, you got to take those for what they are. They're snapshots of a program that is meant to make bigger changes, right? So they're a financial assistance program. Like you have the SNAP program, for example. SNAP program is a good program that allows for intermittent assessments of changes. However, what you really want to know is that the SNAP program is designed to help the whole family, and is the whole family being assisted as opposed to just the intermittent needs that are being met. And a lot of times, depending on the questions being asked, is whether or not the program is working or not. So which brings me to a point that I want to talk about before I get to the next point. Asking the wrong question about a program can definitely affect the interpretation of the data itself. So, in evaluation parlance, in a research parlance, there's a type type, 1, type 2 errors, which are based upon how you interpret data. And they assume, a type 1 and type 2 assumes you ask the right questions, but the error itself is either in the way you've collected the data or where you've analyzed the data. A type 3 error, which falls into the arena in which we work, is when you ask the wrong question. You started off asking the wrong question. It's not, necessarily that people, for example, the SNAP program, it's not necessarily people who are in need of additional resources and services. The real question is that if we put the resources and services that they need, what are they? And if we put the program in place, is it going to address what is really needed as opposed to what we perceive is needed? And if we have a psychological support services program, what are we focusing on the right type of, psychological challenges or support challenges that people have? And what are we basing that on? And we can make wrong assumptions. We can make the assumption, for example, that people, because of the pressure related to, say, having to deal with, missing work or having to deal with COVID or whatever, that people are going to be depressed. Well, yeah, and that stress will lead to depression. Well, that may be true, but what is the bigger impact? Is it the stress part? Is it the depression part? Is it a combination of the two? And so when we design a program, what are we focusing on? Are we focusing on the right outcome that we know? That's that. So to avoid a type 3 error, which means you're asking the wrong question, it means taking a step back and reviewing the information you have, taking time to talk to and work with those that are knowledgeable about this, as well as your own experiences, and then make the decision. Think about this. Many times you have end up asking the wrong questions, not intentionally, but unintentionally. And so you end up with information that, or your evaluation findings, monitoring findings goes in a direction you did not anticipate. And a lot of times it's because you did not ask that question. So the way to avoid it is to really do your homework and to take a step back and work on that. So that's why when you look at impact is ultimately what are the longer changes you want to have. And you don't want to make the mistake to put a program in place, let it run for multiple years, and what you look at as the outcome impact is not what it is you intended, because you were not necessarily looking at the right thing all along. That happens. We've all had that experience. But I want to bring this up because lessons learned is to be very thoughtful, be very circumspect, and do a really good job of that. So if you've done your good, needs, and asset assessment, as well as the other work you've done in the formative process, you will be able to avoid that. So I just want to make that point. So, and that leads us then to the last thing in this neck of the woods in terms of type monitoring evaluation, which is the thing that I mentioned before, which is cost effectiveness and cost benefit. And so cost is not just resource cost, not financial and personnel, things like that. It's also the assessment or the perception that those who are either working in the program, your staff, those who are the recipients of your program, your clients, those who have an investment in your program, your constituents, your other constituents or your other stakeholders, they all are making cost benefit assessments based on the work that's done. So it varies with cost differences. It's a type of assessment that is asked at usually the end of an effort, either end of a program or end of a service delivery and so forth. And they're trying to figure out, what is the price, be it financial or otherwise, of the program, intervention, success or failure? Was it worth it? And we a lot of times don't have the luxury of being able to answer that question, but I can guarantee you that we are in an environment now where that needs to be done. You all may recall in the last session, we talked about the whole thing around systems change. And the thing is that many of you in your comments around systems change were doing a cost benefit or cost effectiveness assessment in your comments when you were talking about, is a program really worth it? And if it's not, is it worth it to make a change in it if it's not, and so forth. You were all making those kinds of comments. Excuse me, and you were addressing the last answer to that question. Particularly the program, if the program doesn't work and it fails, you know, was it worth the effort in the first place? And so you are all trying to get at those things. So I didn't want to make that point that cost benefit is not just in terms of assessment. When you focus on it, it's not just focusing on the financial or the resource part of it. You also need to consider to have some means by which you are addressing, whether it's formally or informally, what are the perceptions of the program related to the success or the failure of the program itself. So I want to make that point as my last point here. And so now I want to just stop for a moment and open it up for questions, comments, and that sort of thing. So I'm going to stop sharing and then open it up. So you can unmute yourself and or put a comment or whatever in the chat, and we can go from there.
Dr. Telfair,
Yeah.
this section on the evaluating assets, could you like provide maybe a scenario even for Healthy Savannah that would be relevant to that? Because that struck me as probably an area of opportunity for us in a big way. I mean, we probably kind of know, but then how do we, like, what would be some recommended next steps?
Okay. Well, can you give me a particular program under Healthy Savannah that you're thinking about?
Not really, because of course we don't have programs. we are fully engaged in the policy and systems change, but
Right.
like,
Yeah.
and we have, and so any grants that we do receive, we tend to focus on, we have our own evaluations slice there that's really more the standard model of evaluation that we've been doing for years and years. But
Right.
the asset place is something that I feel a little unfamiliar with.
Yeah. Well, I guess I was just thinking maybe I was considering the different arenas in which you work as programs. So forgive me.
Okay.
That's the way my brain works. But
Yeah,
I understand
sure.
what you're saying. So so assets has to do with they're both what exists and then what you've accumulated over time, right?
Right.
So let's just go. So for yourself in Healthy Savannah, one of your critical assets has to do with the partnerships that you've developed that allows you to do the work that you've done, right? And those partnerships are very diverse, right? They cross the whole arena. So if you are now looking at an opportunity to come your way, and you would that has to do with a systems change type of thing, be it a health part or social service or whatever part, then what you would do is that that you would go to those, look at your partner type, what it is that they do and what they would bring to the table, and then you would make an assessment, based upon those assets, on that one. And then you would see then, based upon the response to the RFA, what's the gap between those things you would bring to the table and then what's being asked. And I think in the case of Healthy Savannah, you all do not have a huge number of gaps because you have some phenomenal assets. However, way you look at the asset is that then instead of a gap in terms of a need gap, it's more of an enhancement gap. In other words, then, so how can you use your systems change thing to improve the system, enhance the system, such that there are better ways to deliver psychological services, better way to deliver social services, better way to deliver physical health services, and so forth. Are there enhancements to those that already exist that then you could use? So those are that's an asset assessment. And so there's a map, Kretschmann and McKnight, which is the book that this comes from, give you a map of two different communities. One community is what they call a deficit community. And so if you took a map of that community, you'll see things like, here's where poverty exists, here's where crime exists, here's where, homelessness exists and so forth. So that's called a deficit map, right?
Right.
An asset map is where you're saying, okay, same community, but what is the assets of that community? So that means you have social service, you have community health,
Right.
community centers, right? And you have justice persons who deal with the crime, right? You have, homeless shelters that are there. You have the places that provide food services, right?
Right.
So you have those. You have those that do. You have to feed, like for example, we have the American Second Harvest, which is the great part. That's a phenomenal asset related service. So that's kind of the way it is. And so when you do that part, so you are doing now an assessment that is looking at this, like you said, policy, resources kind of deal. And so when you are doing that kind of assessment going forward, your change is going to be a change focused on that. So if I use Healthy Savannah, then I would do it that way. Does that make sense?
Yeah, absolutely. No, I appreciate that. And I think, we do that on individual grants that we write. We go, okay, which one of our partners is, can be strategically engaged in this space of what we don't have that they have. And so, but not holistically, like, I don't think we've really done that. So thank you very much. Appreciate it.
Yeah, and I'm glad you used the word holistically, because it's real critical in an evaluation, independent of when you do the evaluation on that, because you would do more traditional evaluation. But in your case, if you had to take a look, you'd more summative, which is you take all the evaluation data and then look at what the snapshot is at this point in time, and look at that using it retrospectively and that sort of thing. But you'd have to make that assessment as well. So, okay.
Thank you.
Yeah, no problem. Other comments or questions on things that we've discussed so far? Okay, so someone asked, Mr. Bullock asked, to what extent should or could a program conduct an assessment of how these assets might have failed the outcomes of the project? Are you asking, just for point of clarification, Mr. Bullock, are you asking whether or not the assets that we have to discuss them, have they not done what they're supposed to do or not performed at the level they're supposed to perform?
Correct. If we're looking at, as you said, the evaluation as an outcome-based question, yes, we had these resources that we could have tapped into, but as Paula was alluding to, what if those resources, either the policy is not correct or there wasn't adequate access to those resources for the people in the community? Does that come under that as assessment of the asset or in the program evaluation measures?
Yeah, so the program evaluation measures do include, the asset assessment. So they're both a combination. However, what it is that you're looking at is the thing that I was mentioning before, which is the questions, where you go back to evaluation questions. So evaluation question is that you, based upon your knowledge, your experience, and what has been done so far, and you know that one of the assets or one or more of the assets you relied on did not perform at the level they should, the question you would ask not only why it didn't, but if you still think they're viable and needed, then what needs to be done to enhance them in such a way? Because it can happen, right? It happens all the time in the work that we do. Well, for years, there'll be an asset, an agency or an institution or whatever that was just, running on all cylinders and was able to work. And then something happens. They had a leadership change, they had a finance change, they had a, political change, and that now they're not in a position to function the way that they should. So the question, but that they're important because the constituents that they serve or what they do is really critical to your ability to get done what you do. So your question becomes, how do you work with them? How do you set it up in such a way that you would provide that enhancement, to them? So do they need more resources? Do they need to have a greater influence? Let me give you a concrete example from our experience. So we worked in one of our programs where we had been working with a program, a social service program that served really at-risk persons. And they were really doing a great job with it and stuff. But political climate changed. And so that political climate was against serving them because these particular at-risk persons were it was a needle exchange program, and it was supported by one group, and then another group came in and they no longer supported the needle exchange program because these were planned for all kinds of reasons. You've been there, done that. You know what I'm talking about. So the question became then, this population was very critical because we were a program where we were trying to deal with post-incarceration groups of people. And this was a group that we knew dealt with, did a really great job with post-incarceration persons who happened to also be addicted to opioids and that sort of thing. And we know we needed them. They were effective. And so the question became, how do we incorporate them and work with them? So basically, we retooled one of our goals and objectives to use them and to develop an intervention that where they were the center of the intervention. And when we were able to assess whether or not the support we would give them based upon the new resources that we pumped into them, whether those were working or not. And so we did design both goal objectives and a whole set of assessment questions around that. Fortunately, the funders allowed us to do that because the funders did not think the way that the other group, because this was initially a city supported program, and now we moved them into a foundation supported effort. And so we were able to do that. But then we wrote goals, objectives, that sort of thing. So my point is, you, in your position as a leader, need to assess the utility of the asset, and then whether or not it's feasible that you and your program can support that asset in such a way that would make them functional, and viable and that sort of thing. Because not all programs or not all services are fall into the functional, viable, or even accessible category. And so it's a decision as a leader that you have to kind of make, like we did. We had to make a leadership decision. Do we work with these folks knowing their precarious situation or not? And fortunately for us, because of the population we're trying to serve and our support of them, it worked out well for the time frame that we had. It was a 5-year project, and you know how those things go. So does that answer your question, sir?
It did, very much so. Thank you so much.
No problem. Okay, others? But my question to the group or the hall, and if you do or not, so we've covered the overall fundamentals of monitoring and evaluation, and we've covered the types of monitoring and evaluation in terms of the types that are there. Were there anything around types in terms of how they might be used, how they might fit your existing program, how they might address things like the way Ms. Chrysler asked her question, or the way Mr. Bullock asked his question? Do you all have additional things about fit of the types that are there, the understanding of how they work, those kinds of things? Okay, I don't see anybody. All right then. Okay, so we'll go to the next, our next set then. And this is this will be our last set for today, but we'll go to our next set. Okay, so what we're gonna do is talk about the next part of the definitions. And this has to do with very similar to how you make things work. So before we were just talking about definitions and the of the type of evaluations, monitoring evaluation programs. Now we're going to talk more about the operational definitions in terms of the terminology as it relates to how do you make things work. Okay, so on that part. And so the first part we're going to cover is intervention. And so intervention by definition is anything that you plan or design to produce the changes that we talked about before. So for example, hospital-based type 2 diabetes program, prevention program. So it just would be a program that is designed to, whether it be an exercise program, whether it be a nutrition program, and so forth, whether it be a general health education program, life change program, those sort of things. You know, those would be that. So intervention is what you need, and you need an intervention that for evaluation. So in order for an evaluation to take place, you got to have an intervention. So in other words, you got to have a mechanism for the change to occur. Monitoring is just, you know, delivery and that sort of thing. But for evaluation, you have to have an intervention linked to that. Okay. So in other words, again, for an evaluation, you got to have an intervention linked to it because your intent is change. So we remember when we went back, what we said, evaluations are in place if you expect change to happen. Monitoring is in place if you just want to know if something is working the way it's planned. So interventions then is linked to that. And this is an example of diabetes program. The population, and I mentioned this before, and I'll say it again. So these are generally the people you are targeting. These are the people, the programs, these are the peoples, the places, the organizations, the institutions, the units, or whatever it is that the intervention is meant to affect. So the systems change thing that Ms. Chrysler mentioned in and of itself is a target population because systems in themselves are a target. So if you want to change a system, you have to have some kind of intervention that's designed to do that. So yeah, so how the way that something functions. So if you are, and this happens to us in our neck of the woods all the time, where there is an institution or an organization that's working, and however it's subpar, either subpar or it's just not serving the way it should. And while it started out, you know, having the effect as planned, over time it may not be the case. And this is why it's important to assess intermittently whether something is working to make the decisions about, you know, keep, toss, or change. So the target population itself is what it is that you're trying to aim the intervention at. So if you're going to have systems change, you know, to make systems generally to work better than what it should, then the intervention could be whatever it is you're trying to do, whether it's infuse more persons, whether it's infuse more resources, whether it's change personnel, whether it's adjust the target population, whatever is going to be. The whole idea behind it is that you are looking at a very targeted population that you expect and have change to play. So target populations could be any of these entities that I've mentioned, which the program intervention are designed or directed to. So that's how they're linked together. They're also linked based upon what it is of the problem or the challenge you have. If you recall, when we discussed in planning, the suggestion was made that we look at the difference between what's a problem and what's a challenge. Problem, as we discussed it, and this is definitely linked to the way that we in this arena talk about things. The problem is generally something that has really, really tough or either tough or no opportunity to make a real difference with. A challenge is one where we see light at the end of the tunnel. We see that there is a possibility by us providing intervention, targeting the population, we can see change. And so these are conditions, deficiencies, defects, whatever it's going to be, that are designer directed in such a way that we can make a change. So for example, if we have a hospital-based type 2 diabetes prevention program, the expectation and the challenge is that what we see as a challenge and what we see as the results of that challenge being met is that we see the reduction or the improvement in the reduction in a number of persons, developing type 2 diabetes, and or the improvement in the lives of persons with type 2 diabetes, whether it be the adult-based, adult-oriented intervention that we have, an improvement in prescription program that we have, and so forth. Okay, so these are all linked together: the intervention, the population, target population, and the challenging together. And you, as a leader, make a decision whether something is a problem or a challenge. And reality, be what it is going to be your the sieve in which you screen things through. All right, to make that decision. However, most of you are in the business, at least from my discussions with many of you, of dealing with challenges and less of the things of dealing with problems. Although the general language is to call things problems, because that is just the way that the world looks at things. However, we know, based on a lot of work we do, that we're dealing with challenges every day. So that's the overarching bit there. So let's just go down to the other part of this focus in this section, which is on getting things done. And now, so talking about a difference between a goal and an objective. Now, I'm going to cover this in a little bit more detail in this part. So just to be clear, many times, we who are evaluators often will see persons writing goals and calling them objectives, and or writing objectives that are really goals. And let me be clear. So a goal is just a broad statement of a health or social status change, whatever. It does not necessarily need to be measurable, but just logical and targeted. So, if our goal is to improve the way that care to persons who are in need of home services, in other words, then they need in home improvement, so they live in suboptimal housing. And one of the things that we're trying to do is work with the system to provide a means by which the suboptimal housing can be improved, be it renovation, be it providing and training people how to do their own carpentry work, putting people in another place until something is renovated, tearing it down, whatever it's going to be. The whole thing is that we're looking at improvement and changing the suboptimal housing conditions that people live in such a way that improves the quality of lives of persons, independent of who those persons might be. So to say that's our goal. So that's a broad goal, and that's what we want to accomplish and want to do, and that's what we want to target it. Now, the objectives allows us then to make that measurable. And so that means that what we're going to be doing is that we're going to now define our terms. What is suboptimal? What is optimal? What is the elements related to the type of change that we are going to see in terms of differences and so forth? So these are expected to occur because of the intervention itself. And so these are characteristics of that. So I will talk a little bit more about this in terms of SMART objectives. But the whole idea is that when you have a goal, your idea is now to make a change and see what the change might be based upon this objective. An objective is linked to the goal itself. And so when you put together an evaluation plan, you generally have like one or two goals, and for each one or two goals, you generally have three objectives. So generally, it's three objectives, because these allow you to do that. Now, that's just a general area. You may have that. Many of us really push back against having too many objectives. And many times, the reason why we do that is because when you really look at a proposal, that has a lot of objections to that. Most of those objectives are either statements, either questions, or the work itself. So what we do when we're reviewing goals and objectives is that we first look at them with an eye towards, can these objectives be combined? You know, and 9 times out of 10 that you can reduce a proposal that has 5 objectives to either 3 or less, because a lot of the concepts and the ideas and what you want to do are actually just overlapping. And so you want to be able to do that. You also look for them in terms of the SMART components, and I'll show you that in a minute. You know, of those are they you know, targeted, you know, are they measurable, you know, are they realistic, and so forth, and are they timely? And so you want to be able to look at those in that way. The other part of it is that do they address and are they linked clearly to either an intervention and or to the goal itself? So those are the components you have. Now, how do you do the linkages has more to do with the steps that you take that are linked to the objective. And in these steps are generally called elements or tasks or programs, or these are basically, it's what you will do. You know, so if an objective is stating an activity, which is part of the SMART component to that, then the identifiable and discrete interventions themselves. And that's the challenge. That's what the overlap is that we're looking, when we assess an objective, so we're looking to see whether or not they're discrete and whether or not they are clearly identifiable, because this has to do with a measurement part. If you have ill-defined activity or interventions that are just not clearly defined, and or interventions that overlap, you know, then you're not going to be able to measure them. So if you say we're going to do an objective this and that, or this or that, that's called, you know, a compound statement or an overlapping statement. And the question becomes, what are you measuring? You can't just measure this or that. You can't just measure this and that. It either has to be this, that, and those need to be discrete. So keep in mind that when you are putting together an objective and you're putting together the task, whatever the objectives, that what you're measuring needs to be discrete and singly identifiable as best you can. Now, realistically, sometimes I should say realistically, and sometimes it is a challenge to do that, depending on what the program is. This is why it's so important that you write things out clearly, you make a decision if something is measurable or not, and that you have a specific objectives linked to it. Now, measurability, as we have, and discreteness, just to be clear, does not necessarily mean it has to be a number. It could be a concept, an idea, it could be qualitative as well. And you could have either qualitative or quantitative measure. And we can discuss what those look like. However, we will not probably have the amount of time to look at that. We will actually, not today, but in the third or fourth day, I will give you some very clear, concrete examples of how to do that. Even with the program assessment and the program treatment, I've listed most of those as quantitative, but I will also follow through with what's qualitative. And the reason why I bring this up as important is because a lot of the work we do has to do with our interaction with persons and our making of judgments that are either that are not as clearly objective in terms of an assessment as they are, as opposed to making a judgment call, which happens all the time. And so you can measure that. You can measure consensus and other things. You just have to make sure that when you design your objective or you design your assessment, that you include those components into that assessment, and that allows you to make that call. And this has a lot to do with the service delivery components of a program and the service delivery component of any kind of work that you're doing. So please keep that in mind, and we'll come back to that. And if you have questions, I can give you some concrete examples of that. All right, so the next thing in terms of definition, and these are all, again, These are all, by the way, I should say, in the 8 Steps book, that handbook that I've written and given to you all. So an indicator is a critical component of your evaluation process. So it measures a reflection of either a system and or something, that points to a problem or a condition. In other words, that is sort of the traditional definition. I would say it points to a challenge or condition that you have. It's measurable in terms of where it corresponds to a cognitive program, health condition, or social condition, and at the population level for the program intervention. So in the population or individual level that you have, it's something that you're looking at. So it's sort of an indicator would be level of depression, level of stress, level of service, level of food consumption, level of or the number of this or the number of that. And what it's trying to do is reflects the status of that. So what are you looking at? The number of persons who successfully got their second shot for COVID, or those that got a booster, right? Those that you've got to, that were there, and the number of persons who had breakout infections. And then another condition would be the keywords, key phrases, key statements related to the why of those things. What are the descriptors, of the conditions that led to these types of conditions, problems, or challenges. So you have a quantitative part, but also you have explanatory part. And so indicators you can have, again, just like you have with tasks, you can or measures, you can have both quantitative and qualitative. And it's important that you make that decision as a leader based upon the work that you have. So indicators provided means we're talking about how conditions match what you're trying to get at, and what the resources you have and so forth. But you use that. And in the research language, they're called variables that you're measuring. So let me just kind of lay it out a little bit for you. It's a little bit clearer if I can. So I'm going to show you a couple of things, a couple of slides to cover this. So first of all, the most important point about indicators that it's really, really important for you, is relevant, is the possibility that, it's possible to me to serve the program under observation that they may use to spur constructive change, and that they're a true measure of what it is you're looking at. So in other words, then the indicator itself must be what it is that you're interested in. And so that means that it's a good indicator in terms of data itself, in terms of what's relevant, what's credible, what's valid, what's reliable over time, how well does it compare to what it is you're looking at, can you access it in an affordable way, and can you understand it? So again, an indicator is, when we have these all the time, is making a decision of what it is that you're measuring based upon a commonly understood and or a operationally defined and or even a dictionarily defined or a defined in such a way that those who are funding you define it. Whatever the idea is that it meets these characteristics that are in note 2. And by example, you have things like knowledge of HIV, AIDS, rates of violent behavior, rates of unwanted or unintended, pregnancy, and so forth. Those are all indicators, and how those indicators apply to what it is that you're working on is a decision that you, as make based on your program itself. So, and that's what it is. I'm sorry.
Go ahead, Dr. Telfair. We have somebody's raised their hand.
Okay, all right. Let me just finish. So I'm just going to say, so based upon that, that is the understanding that you have. So let me stop and share, and let me answer the question. I'm sorry. Go ahead, whoever raised their hand.
Good. Kimberly?
Hey, yeah, this is Kim Hawk. So I have a question about indicators versus objectives.
Mhm.
I think I'm having a hard time kind of wrapping my brain around the different. I mean, I'm assuming that indicators are zoom in to what the objective is. Am I understanding correctly?
Yeah, okay, so yeah, so the indicator is what it is that you're measuring, okay? However way you define it. Okay, and then the objective, you know, is the structure of that type of thing that includes the measurement. So in other words, then there's a statement, and I thought I had it here. My apologies, because I would give you an example. Let me pause for a moment. It's a really good question. So let me pause for a moment and look at my my slide deck. Sorry. I think yeah, I'm going to get to it, but it's not with this group. So let me just quickly explain it to you. Let me just quickly explain to you. So objective. So you have a goal, the goal itself. So the anatomy of an evaluation is that you have goals, objectives, activities, and then indicators. Okay. So overarching part is the goal. That's what you're trying to, you know, that's what your wish is. Objective says, okay, based on what it is we want to do, we will accomplish this goal this way, right? We're going to accomplish this goal based upon, here's what we're going to measure, which our indicators are. Here's what we're going to do, which our activities are. Here's the time frame in which we're going to accomplish it. And then here are the population in which we're going to focus on. So indicators are a part of the objective itself. It is embedded in the objective such that you want to measure it. So I'll give you an example. So let's just say we have a type 2 diabetes program, right? And the goal of the diabetes program is to improve the lives of persons with type 2 diabetes. That's what we want to accomplish, right? And so we break that up into 3 different objectives. One of it, one objective is that we will plan to provide better access to prescribed medications for adults ages 18 to 54, who come into our program over the next year, right? And we will provide that. So the indicator, how we will know it's working, is that we will have an indicator that's labeled access to prescription drugs. All right, that would be your indicator. And so you could define access as anyway, like, coming to to our outpatient clinic. That's one definition. Using our telehealth as another definition. Actually picking the prescribed medications up, meeting with the diagnostic services. Those are all sub levels. Those are all indicators of whether or not the concept of access to prescription services work. So those are all the things you would measure, and you could measure all of them or some of them or part of them. So that's the relationship. So objectives, it tells you what it is you want, how it is you're going to meet the goal, and then all the things you need that you're going to do over, in a smart way, right? So what the subject is, what you're going to measure, how you're going to, the assessment of it, what the relevance of it is, and what the timeliness of it is. Okay, and we will go over that. I kind of broke it up, and I'm sorry, I should have, do this, but we will definitely get into this in much more detail.
Okay.
A little bit later, but that's just the overview.
So if I'm clear, the indicator is more so like how you're going to do it, and the objective is like what you're going to do.
So the indicator is what you're going to measure.
What you're going to measure. Okay.
Right. And the objective is the what is you going to do. Right.
Okay.
It includes the what, and the how, and the why, and the when. So objective says what, how, why, and when. That answers that. But the what is the objective. Okay. So in that list, what is the objective, which is embedded in what is the indicator, which is embedded in the objective.
Okay. Thank you for explaining that.
No problem. And it's also in the 8 Steps handbook. Okay. And I go into it in great detail in that. So does that answer your question though? Oh, you have the 8 Steps book. I see that. Perfect. Yeah. All right. Okay.
Yeah. Thank you.
No problem. Is it okay? Good. Any other questions? All right, good. Okay, so let me go back to this then. Okay, so the next part of this, the indicators. So indicators or you know, what's a good indicator? Just to go back to this, and I'm glad Ms. Park asked the question. So what's a good indicator for you in your work? So a good indicator, characteristic of a good indicator is that it's relevant, it's credible, it's valid, it's reliable over time. You know, it's relevant. So that means that it's a fit with what it is you're trying to measure. So if you're trying to measure, you know, access to appropriate medication for diabetes, then an indicator would be just that, which is that are you is the how you ever you define, you know, appropriate, which is based on a diagnostic category, you know, that. So is it relevant? So is it meeting the diagnostic criteria, you know, for a good medication, first of all, and second of all, is it meeting based on whatever you're assessing good access, which is that are they getting it based on the treatment plan and so forth. Credible is one where you're actually measuring that, and it is something that everyone says, you know, it is the appropriate way to look at this question. So, you know, are they using it? And essentially, is it looking at the use of the medication in a way that it's supposed to, and is it valid? So does it make sense that way, and is it reliable over time? So can you measure it, or does it fall apart, you know, after or not? You know, can you reliably say that this holds up over time? In other words, is it where you a judgment in? Is it comparable to other indicators? Can you switch out, you know, a good indicator of appropriate access in versus another way to look at that? And then can you measure it? And accessibility and affordability has to do with, can you collect the data? Do you have something in place that you can collect this type of indicator or collect this indicator in such a way, and that you can rely on it? Can it be accessible? It can be something you get through self-report? Can you get through survey data or whatever? And then is it understandable? Is it understandable to those that are doing the work? So is it understandable to you, to your program, to those working with you? And then that's why I gave the multiple examples there. All right, so the other part of the work in terms of work definitions is it was what is used in programs. So I mentioned earlier that we had the Healthy Start program, you know, that's the national program out of you know, Health Services and Resource Services Health and Resource Services Administration, HRSA. And it's very much similar to you all, I think, in Healthy Savannah, you focus on benchmarks. And so benchmarks are at the component or the policy level or component level, and it's usually quantifiable in such a way that it tells whether a program is advancing or not, or whether an effort is advancing or not. And it could be either intermittently measured, like you know, intermittent outcome measured, or ultimately, and it tells you whether those are being met. And generally, how this works is that these are usually set beforehand. These look at a program or a service or agency, or I mean, an effort, and they say, here's where we want to go. There's the target that we want to reach. And, you know, and then are we, as we look at this over time, are we meeting our benchmark? So if we say that we want to see a decrease in the number of at-risk youth who are engaging in risky drug behavior. And right now, our baseline is, you know, based on our population, we have a baseline that is of the youth we've assessed is 15%. And what we want to do is at the end of the program, we would like to have that number reduced to a realistic number, which would be 8 or 9%. And so based upon the intervention that we're doing or the work that we're doing over this 5-year period, at the end of each year, what does that number based upon the population that we're serving look like? Are we seeing a decrease in those or that, and how close to the benchmark or how close to the ultimate target we want is there? So, and so what we would project is that if it's a 5-year program and we want to reduce it by, say, to 9% from 15%, then we're looking at a 0.8 or so, reduction over time or by each year, which we think ultimately will give us, go from 15 to 8 or 9%. And if we're doing better than that, great. If we're not doing better than that, then we're in trouble. So benchmarks are the measurable targets that tell you whether a program is progressing well that it should. So it's part of the monitoring effort, and then for the most part, but it's also part of the evaluation effort if there's an intervention involved. And the measure itself is what are you looking at there? It's calculating the extent that the objects are being achieved, and it's part of that SMART objective. But you also then work from this. So I want to say really clearly, many times, what happens a lot is that benchmarks are set or even measures are set, and there's not the adequate assessment of the evidence or the data that goes into this, which is why it's important to have baseline information. So you should never set, realistically, never set a benchmark target. If you can, for the most part, I would just say in general, don't set a benchmark target unless you have a baseline to work from. So if you know that you want to reduce, a certain type of challenge by so much, then what is the baseline? What are you starting from? Baseline means the information that you're starting from. And so what is the indicator there? So the indicator of measuring participation in risky behavior, that's an indicator. And then reduction in that indicator is going to be based upon what is the level of participation now, right? And so you've identified it that way, but you really shouldn't. Now, I know this happens where benchmarks are set and all the time. And when we assess these, we always ask, what is the benchmark? What are you starting from? Now, that's one thing, but there's a caveat to that. And I think the caveat you all know. I'm not going to say anything you don't already know. Sometimes you don't have a baseline. Sometimes you don't have an idea of what it is and what a challenge looks like at this point. So the answer to that is to then use your best judgment based upon what it is that either experience tells you, what it is you've researched, and so forth that's relevant to you. And do the best you can with that part of it. And if it's really shaky, then you should in your application say, we don't at this point have evidence for this, but based upon our experience, this is what we anticipate. That's one caveat. The other big caveat in terms of setting a baseline is don't over promise, which happens all the time. I've seen programs where they said, we're going to tackle something that's a really tough thing to do, like, reduce of crime and violence, from 20% to like 6%. And I've seen people do that. And I'm thinking, how are you going to make that work over 5 years, given that you've been dealing with this issue for 15 years? And that happens. No judgment. I'm just saying, be realistic. I have a tendency, and many of us who in the evaluation field, we recommend being conservative with your numbers and justify that conservativeness than being overly promised. Because we know a lot of times the temptation is overpromise because it makes your application looks better. And that's, we know, is what people tell us all the time. And our pushback is don't do that. Be realistic, justify the realism. If you're thinking you want to reduce the number of crime and violence and you have a sense that it's at 20% of the target population you're working with, then be conservative and say you want to reduce it, to 15% because the evidence shows that this has been an issue for a long time and we don't know how well our intervention is going to work, but we need time to test it out and to figure out, if we can make that difference. And then the next cycle, if your intervention did work as planned, then you could be a little bit more liberal with your estimate and baseline to work with. So my strong suggestion is when you're setting a benchmark measure or baseline, start with a conservative perspective, and or perspective that's based upon the evidence. So if you've been doing this program for a while and this stuff is worked, or you have a good sense of it, yeah, then go for it. However, if you there's a real challenge here and that challenge is really strong, they do this. So and some programs in themselves are going to be really tough to deal with. And they're going to be, they're persistent, they're consistent. They are these really, just tough challenges that we have all the time. And so be realistic about that. It's all, just is my recommendation in terms of as an assessment person. Now, the other part here is, I'm going to go over these because of time here, is an index. An index is actually a little bit more complicated, and we'll talk about this again later on. So if you don't quite understand this, ask, and then I will fill you in, and we will also talk about this again. Now, index itself is a collection of indicators and or measures that you consider as a whole. So for example, if well-being, quality of life, those sort of things, are what you're concerned about, then you have a collection of these. And I've given you a concrete example. So say you have an index of basic health services, which measures the percent of primary care providers for adolescents. So the indicators you would have is percent of providers accepting public insurance versus cash, or percent of services for special needs population, or quality of rating of health services, so on and so forth. So the idea is that an index allows you to have multiple indicators to look at an outcome. And so an outcome itself is going to be defined based on not a single indicator, but multiple indicators. And so you use an index, which is a collection of indicators or measures as opposed to a single one. And so there are categories of indicators and measures, and these are listed in the 8 steps books that I gave you. But the best example, are like healthy communities, and healthy, like Robert Wood Johnson's Healthy Communities, Healthy Services program that has a whole host of indicators that you can look at, for that. An index that tells you, that measures something like quality of life or well-being or equity or something like that. There's no single indicator. The other part of this, and you all know this already, is that you cannot define a challenge as always a cause and effect. So there's not always a single indicator that will tell you whether something is changed or not. You really do need to look at multiple indicators. So I would just say understanding what indicators are, which are measures, but also a collective of measures, which is an index that allows you to do this. So it allows you to look at this. So if you are assessing a program and the program has a sort of complex outcome, then my strong recommendation is to develop a collection of indicators that allows you to look at that. And those examples are in your 8 steps book, and we will also go over that a little bit later. So we have, the quantitative things, as I promised. You know what these are already: quantitative or numerical indicators for something you're trying to achieve, like quantity or amount, date of anticipated achievement, 10% increase by June 2020. So for example, in your objective, and you're looking at like the diabetes delivery program, you would say that you are targeting, that you will accomplish the diabetes service program by targeting, adults, male and female, 18 to 54, who live in the catchment area of the hospital itself. And you have a baseline of access to good medical care. We will change that from 20% to 10%. You change it from 5% to 10%, and you will see this increase over time by June 30th of 2020. So you're starting the program in, roughly in 1 July, of 2015, and over the next 5 years, you expect to see a 10% increase by the end of the 5-year period. So that's what this would be, for example. And this is a quantitative way. Qualitatively, taking a similar idea, these are generally agreed upon statements that you have, in that, they're usually part of a mixed method evaluation where you're using both quantitative and qualitative part. And generally, you have an agreed upon time frame for statements to be collected, or you have a date that's mixing those. So, for example, you would have a consensus that those working in a program have all achieved a certain target. They've all agreed to implement a program. Whether or not it's implemented or not is one thing, but they've reached that agreement that they're going to do this by the end of the process period, which is 30th of June. They started on July 1. And over time, you expect to have more providers involved, and more of them will agree to it. So it's not enough just to have a count of providers, but these are providers who have also agreed for whatever reason they give you to participate, actively participate in this better access to diabetes medications for your targeted population. Okay. And then you want to look at the outcome of that. Sorry about that, I'm a little ahead of myself there. The results, which is the results of the effect or the impact expected, intended, in the long term. So the thing you want to remember here, of course, is that of particular interest, to like regional, national programs, is that you're looking for, activities, whether it be intermittent, intermediate or proximal outcomes, which are there, and then those that are further away, which are just the ultimate outcomes or impacts. And this is covered in the book that you have on this one. So I want to end this session, my talk on this session, to walk you through this, to give you an idea of what this should look like. So this is the 5-tier approach to evaluation. This is basically what we would also consider anatomy of an evaluation, based upon everything I've covered so far. And I pulled this example from a child and family program evaluation that Jacobs and colleagues did. And this is from their work on applied environmental science a little while back. So what you have then at the very top, so we're going to go from the left side to the right side, and then across the top you have the thing. So across the top you have purpose of the evaluation, the task or the work to be done, and then a type of data to collect and to analyze. So this addresses a number of questions that you all had. And I wanted to give you this as an extremely detailed, concrete example of everything that we spoken about so far. So column 1 is a type of needs asset assessment. And so what kind of evaluation you have is you have that focuses on the document of the programs and or the challenges where it determines unmet need. It has a program that's focusing on options, and it's also set the data and set the baseline for that. What you need to do in terms of that is you review the existing data, you get additional data, identify data, and so forth, and then you make recommendations in terms of the gap based upon the discussion that we had. And then the type of data, of course, is going to be based upon what it is that you've decided based on goals and objectives that you really want to look at. So then you have monitoring and accountability, which is another level of this work itself. And so this is the monitoring part. If you just want to monitor, so the just want to monitor is just assessing performance. And you have that PowerPoint that looks at developing performance measures. And I would suggest taking a look at that and seeing this. So what you're saying is that you want to look at a program that meets the demand for accountability, that builds consistency and so forth. However, the task is that you have to determine whether or not the program is accessible. So that means the capacity for producing data. Does the data exist? Does the data management exist? Can you collect the data? Can you analyze the data? Is it relevant? And so I'll give you some examples like MIS data, which is medical information systems data, case material from your case records, from your program records, and so forth. So what if you want to do a quality review and program clarification, as part of your assessment, which is a QA, QI kind of thing, which a lot of you do and are asked to do. And so I'll give you an example of how to do that with a focus on reviewing monitoring data for the most part, because that's what that is, implementation and monitoring data. And then I give you some examples of that. And then you want to achieve outcomes. So be they proximal or intermediate outcomes. I give you an example of the kind of considerations you need to have in terms of the purpose of the evaluation on that part, and then the type of task or work that needs to be done, and then the type of data, for example, you might want to use. And then the last thing is looking at impact. So those long-term type of assessment. So what do you need to consider if impact is what your intent is? So that means that, I'll give you some examples of what to look at, like knowledge, how does it contribute to your knowledge? How does it contribute to lessons learned? Effectiveness, what it is you're trying to do and so forth. And then, pick, the results that you have from your outcomes, and then you aggregate those. You pull those together, put them collectively, and you say how that goes. And then based upon, say, the example that Jacobs and his colleagues use, you have that. So what this table does, just to be clear, is that it tells you, it gives you an idea of how do you go about linking the program planning process, which we discussed in the last training, to the monitoring evaluation process. How do you sort of get started with that? And so the critical things to think about is the purpose of why you're doing the monitoring evaluation, the things you think you want to accomplish, and then the type of information that you think you need, independent of what the focus of that might be, whether anything from a needs assessment to an impact assessment. And I wanted to leave you with that table because this is a bit of a summary of what we talked about so far. And we will go over more of this because I'm going to give you even more detail and more hands-on stuff in the days to come. But I wanted to at least leave you with this before we close out with the end of our section, knowledge and questions. So I'm going to move to the section, knowledge and questions. I'm going to stop sharing, and I'm going to open it up to any knowledge and questions that you might have at this point, or any questions you might have at this point.
Dr. Telfair, I was just thinking about, the CGIC hosts a lot of indicators on our website, lots of them. And if you're starting to dip your toes in on what indicators are, that's a great place to start.
Okay.
You can literally go in to the data tab and type in a word, and it will populate all the indicators that are on our website. There's also a data tool that we have that is that's on their Georgia Family Connections website, that is an online calculator where you can take a data point like children living in poverty. And you can say, I want to have a 5% impact on that. And it'll actually show you what the number of children you would need to impact in order to move that indicator 5%. So I think I'm just mentioning that as a way of looking at data that may be useful, just as a way of getting our brains around how do we have an impact, and what does it take for us to do that. So that's just a thought that I would add into our discussions. And so questions, comments, thoughts from anyone?
I just want to say that this has been really informative and has helped me think of things in a different way or a different perspective. So thank you so much.
Thank you. Can you elaborate a little bit about the different perspective part?
Just a piece, well, just one example would be just how the language I use in regards to objectives, in regards to indicators. I think a lot of times we use it and goals, we just use it interchangeably. But now knowing, and I think I know, but I guess I don't know, but now making sure I'm very clear on what that looks like moving forward in my work.
Thank you. So, and Ms. Anderson, what agency are you from?
I'm with Gateway Community Service Corps, and I'm
Okay.
the program manager of our APEX program.
Okay, thank you. Thank you for your comment.
Mhm.
Mr. Bullock asked, so is there a rule of thumb for establishing benchmarks? and then how useful would it be to use evidence from similar research-based programs? So basically, Mr. Bullock, you answered, partially answered your own question. Benchmarks, are bulk. They come from multiple sources. So part of it is that if they're a similar program, then they will give you some idea or some ballpark of what it is that your target would be. That's one thing. The other part is that benchmarks are established generally from your own work. So, example, if you have a program that in and of itself has been working with the same population, say at-risk adults who just themselves been released from incarceration, like we did, then one of the things that we had in common, is that we looked back on similar types of interventions that we did with that population. It wasn't the one related to their, at risk related to opioid use, but it was other types of risk. And so we extrapolated the number, the benchmark from that, because we didn't have one. It was a new program, we didn't have it. So we did that and we justified it. That's the second thing you need to do. Whatever reason you choose a benchmark, you have to definitely scientifically justify that use of that benchmark. And most of the time it's going to be on evidence, but sometimes it's going to be based on observation, right? Because there are programs where it doesn't exist. For example, going back not too long ago, some of you who work with homeless populations know this. Not too long ago, majority of the persons who took advantage of homeless services were men, right? And then, we remember what, a decade or so ago, or maybe a little further back, we started seeing families growing. And today, the largest population of use of homeless services are now, families, women, single women and families, which weren't the case before. So we had no data to work on, but we knew from working with men, and we knew from men, we could extrapolate that a little bit, but over time, we targeted learning more about that population and so forth. So based upon our own youth, but also the existing, a lot of times the challenge of using data from the literature is that the literature many times do not, as a whole, talk about stuff that didn't work, right? They talk most about stuff that worked. And also do not always talk about interventions, but they per se. So you have to sort of make sure that you are very circumspect, as well as very use a very, very good way to review that information there. And also know that because a lot of times people don't talk about things that didn't work, it doesn't mean that it's not useful. It just means that they didn't report it, right? Think of how many of the things that we have tried that did not work, right? And so we hesitant, based upon just the way we're conditioned in our neck of the woods, to not talk about stuff that didn't work because how it looks, how it's perceived, and so forth. I'm a firm believer that all evidence, work or didn't work, is good evidence. But what works is that how you explain it, right? So for example, say you did a needle exchange program, and the needle exchange program didn't go as you had planned. In other words, then the number of people using it were much smaller than you anticipated it would go. So that means the program wasn't reaching the number and the target population you had. So the question is not so much as why it failed, it's more like why it didn't work, which is not the same question. And so does that mean that we had to make changes to the program? That means we have to broaden our assets, our reach, and work with other people and so forth. Those are the kinds of things that move the needle. Moving the needle by repeating and doing the same thing over and over again is necessary, but it's not sufficient. The kinds of challenges that we have in our neck of the woods, in our populations, are these really complex, not great challenges. And so if we're going to tackle those, then we also need to be able to take advantage of what lessons we've learned, whether lessons we've learned that worked, lessons we've learned that didn't work, and just be very, very critical and very problem oriented and work on those. A good monitoring evaluation system is one where the baseline data and the finding data is based upon really good observation, problem solving, and evidence building from that. I mean, it's a long. I will stop there, but you get my point. I could go on because this is one of my pet peeves that you probably haven't figured out yet. But yeah,
I got it. Thank you so much, Dr. Telfair.
Yeah,
Thank you
no
for
problem.
the presentation also. It was outstanding.
Great. Okay. Well, there's more to come. So
Dr. Telfair,
Yeah.
it's okay if I give an example of
of course,
something.
yeah.
So, for instance, many of you know that we worked on the behavioral health unit with the Savannah Police Department. And one of the pieces of that grant that we worked on was bringing training to officers and creating an enhanced crisis intervention training program. And one of the things that we did, one of the indicators we looked at was what was happening. So our baseline was what was happening before we started the grant. So what was happening in terms of crisis intervention training that would point to how officers respond to behavioral health calls. And that was our baseline, to look at what training was offered, what officers were taking the training, those kinds of things is to determine what our baseline was. And then we offered what our intervention was, which was the enhanced crisis intervention training. And then the post part of it is how did the training impact how they respond to behavioral health calls? So those are that. So I wanted to point more towards how we decided on the baseline part of it.
Thank you, Ms. Roberts. So it's, even though the baseline, that's the point you're making, is that while you didn't have the exact type of program with the exact indicators for the exact intervention, you had relevant ones, and you had relative ones, or ones that were linked in some way that you could actually strongly justify use of. That's your point.
Yes.
Okay. Thank you. And then thank you for the indicators comment as well. And so Ms. Park had, I agree with you about the insanity bit. You're absolutely right. Other questions or comments about the three sections or modules we've covered today? Okay, so just a highlight then of the next week. So next week, we're going to cover something that's relevant to what you all do, which are starting with mission statement, goals, and objectives. And then, so Ms. Park, what we're going to do is give you multiple examples of what a SMART objectives look like, how indicators are linked, and so forth. So we're going to do that part. And then we're also going to get you started on how to develop from the very first thing that was asked about data early on. I think it was Mr. Thomas that asked that question. Excuse me. We are going to sort of talk about how to decide on the data question. So we're going to cover that next time. So both of those things that you all asked, we're going to go into in great detail. And then, so we'll go from there. All right.
Okay, any other questions, last questions or comments before we close today? We appreciate, go ahead, Dr. Telfair.
No, I was going to say, okay, so thank you everyone for
Yeah.
taking the time.
Yeah, and as you're thinking about stacking on more learning, let's all, and this is including me as well, let's all go back and look at what we learned today and review that in advance of our next meeting, which is a week from today, and discern what we can pull forward from that and how is it relevant to the work that each of us in our organizations are doing. So with that, thanks everybody for being here. Paula, do you have any parting comments?
The same as what everyone's been saying is great all the way around. So excited. So many of our key stakeholders are engaged here, and and staff, we're learning a lot, and I'm just excited. So looking forward to next week.
Okay.
Thank you.
Right, and I would just echo that you go back, because we're going to start the session by just asking you of the stack question, which is using what we have to look at what it is that you're doing. And so we hope to be able to start from there the next go round. Okay. All right. Thank you, Ms. Roberts, Ms. Kressler, Ms. McConaughey. That's what I have today. Thank you.
Thank you.
I'll have a good rest of the week and weekend. All right.
Thank you, Dr. Telfair.
All right. Talk to you next week.
Okay.
Bye.
Thank you.
Okay.
Thank you.